So as people start to join, we might get some feedback if everybody's not on mute.
Good to go, Ian.
Okay. Good evening and welcome to the Westborough Board of Selectmen. This is a joint meeting tonight with the Board of Selectmen and the Westborough Board of Health, at least for part of it, and maybe for the whole thing, depending on the Board of Health's decision as whether they will adjourn early as we continue with some of the other sole Board of Selectmen items. Thank you everyone for joining, and please bear with us. This is the first time going under the new role of remote participation. And in regards to that, in the declaration and provisions that we accepted at the last meeting, I need to read this statement that I'll do at this point, just to make sure we're official here. But pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Paragraph 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Westborough Board of Selectmen and Westborough Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by tuning into Westborough TV's government channels, that's Verizon Channel 28 or Channel 192, or streaming online at westboroughTV.org/live-stream.government. And so with that, I would ask Selectman Edinburgh to help us up. I would like to start off the meeting, as always, with the Pledge of Allegiance. I think we have...
Hold on 1 second.
Okay, thank you.
There we go.
Great. So I pledge allegiance
to the flag
of the United States of America,
the States of America,
and to the republic
for which it stands, one nation,
under
under us,
indivisible,
with liberty and justice for all. I hope.
Well, thank you for that. And we'll jump right into important upcoming town events activities. And I'd just like to start off again. Thank you, everyone, for participating with us in this board meeting and via remote. I would like to thank Selectman Alan Edinburgh, Mark Stockman, Karen Henderson, the folks at Westborough TV for all the work they put in to make this accessible for us as we practice our social distancing and kind of our stay at home per the orders of the governor. So thank you very much for that. Hopefully the town appreciates us doing our part as we ask everyone to do. I would like to thank the town staff as well, our town manager, Christy Williams, and the rest of the staff for the yeoman's work that everyone has done in all that we've done. Specifically, I also like to thank Steve Bakari from the department, from the Board of Health and our board as well for the work that we've done in this trying and really for all of us, I think, unprecedented times. And also would like to thank all our residents for all that you're doing to help out in the community, to keep us safe, to abide by the rules that are there. We know this is difficult times. We know it's difficult for you. We know it's difficult for our businesses, but we appreciate everyone's working with us, everyone's patience, everyone's consideration of our fellow citizens and doing what we all can do to hopefully flatten the curve of what we're dealing with here. So that's what I just wanted to start out with, and then I will turn it to the other selectmen right now in terms of upcoming town events activities. I would start with, as I see it here, Selectman Marshall.
in the interest of time and the priorities before the board, I don't have anything specific in.
Thank you. Selectman Emery.
Hi, thanks, Ian. We didn't have open forum on the agenda, so I'm going to add this right now. At our last meeting, our head of DPW mentioned that we shouldn't be flushing anything except toilet paper down the toilets because it creates a huge problem. So I wanted to say that at the very front of the end of the meeting where most people might be listening. I think maybe they don't understand that if things get clogged and the grinders can't take care of them, you might imagine what that means, then a person has to go down there and clean out the grinder, and it can slow everything down. And evidently it's a nationwide problem, but I would hope that we don't have that problem in our town and that people be careful, only flush toilet paper.
Thank you very much, Lee. Appreciate that. Selectman Hashmi.
Nothing.
Selectman Edinburgh.
Yes, very quickly. No specific dates because there's several, but the Corridor 9 495 Chamber of Commerce is running webinars and web meetings for small businesses almost on a daily basis right now, covering everything from financial assistance to HR issues to loan issues, everything like that. So check their website and their event calendar. There's some great resources there for information.
Great. And actually, go a little bit off script here, but to our town manager, I'm not anything that you have in this portion before we go to the joint meeting. I don't know if there's anything around town events activities that you want to add in at this point.
Yeah, so we've been updating our website and also our social media page pretty consistently. But I think the most important thing for the community is that Governor Baker announced a new ability to get updates and information on your phone. So that's on our social media page and it's going on our website, but you need to text COVID-MA, so COVID-MA to 888-777, and then you'll be added to a list where you'll receive alerts directly to your phone.
Perfect. Thank you.
Mr. Chair, sorry, it's Sayed. Speaking of which, sorry, can I just say something? Is that okay?
Yep. Can you speak up a little bit louder?
Yeah, sorry.
Just yeah.
So what I was going to say is that there's also there's 211, which is on our website, the town's website. So if you have concerns with mental, concerns with anxiety or, with the weight of everything that's going on, so you can also call 211. And I think there's also the referral service to the town. So there are multiple resources. So if this is a unprecedented emergency and it leads to a lot of stress, so there are resources. So just don't be scared to reach out.
Great. Thank you, Sayed.
Can I just say one thing about 211?
Yes.
Sometimes the waits can be long. I've been told they've been up to 90 minutes. People can leave a message and they will call you back. You don't have to hang on for that long.
Great. Thank you, Steve.
Also, the Youth and Family Services Department is still operating, even though they're remote. So you can absolutely contact the main number and it'll go to one of our staff members and they can help you as well.
Great. And thank you. Just to hit on that, as town manager said, that please, for folks watching on there, to regularly check the town's website. We are updating the information out there, and we'll continue to do that. It's a great place to get it. We're also posting things out through various social media, trying to get as much information out as possible. And as always, you can reach out to the town manager, Selectmen's office. You can reach us by email if any questions come in. So please, at any time, we encourage folks to reach out. While we're remote, we are still all working and want to hear from folks with any concerns, issues, or suggestions. So please do that. Okay, moving on to the agenda, just want to move into our kind of joint meeting with the Board of Health to discuss a few things. I guess what I'd like to do is turn it over to right now to the chair of the Board of Health, Nathan Walsh. Nathan and I had a chance to talk a little bit earlier this week, but I think what would be really helpful is kind of from an education for the community to really talk about the process, and Nathan and Steve, whoever else from the Board of Health, to really talk about the process that we go through with potential coronavirus cases, and really kind of expound on how that works. I know there's been a lot of questions and concerns about that process. So,
Ian, this is Shelby. Can I just jump in? Could you explain to everyone maybe the colored shirts in case they're not sure, because we're sitting in various locations?
Sure. My understanding is that if you're wearing white, you're a Board of Selectmen. If you're wearing blue, you're a Board of Health. And if you're the town manager, you're wearing black.
Good. So this is Nathan Walsh, the chairman of the board. Oh, can you guys hear me? Yeah.
Yes, you can. Yep.
So this is the chairman of the Board of Health, and I do have a slide deck. I was asked a number of questions by the Board of Selectmen and wanted to give a chance to answer those questions. I don't know if the slide deck is up on the screen because I still see Ian up on the screen right now. Oh, excellent. Good. So if we go to the next slide, the questions that the board had asked was kind of describing from the sample test to a confirmed case, what is the workflow? How does that whole process operate? Second question was who can get tested? The next question was when can healthcare providers return to work? Questions about kind of HIPAA and patient privacy and how does that impact what the Board of Health is allowed to say? And then questions about kind of giving an update on local cases. So I was going to tackle those in those order. Obviously, if anyone has any questions, they should feel free to jump in terms of the Board of Health or the Board of Selectmen. I've tried to put this together, but I haven't really talked with the other members of the Board of Health about this. So please just jump in if I say something that you want to expand on. So in terms of how the process works, if there's a symptomatic patient, the patient goes in and sees the doctor, and that kind of it begins the process of isolation, where the doctor and the patient evaluate. The doctor suspects that the patient might have symptoms of COVID-19. The COVID-19 test is sent to a state health lab or other testing facility. Usually takes 24 to 48 hours for the state health lab to process that test, I think, right now. And when that test is done, the doctor is notified, who then notifies the patient. There's a separate system where the state health lab also, usually the next morning, will update the MAVEN system. Now, MAVEN is a system that is used, an electronic system to help the boards of health track epidemics and cases. And so this system has been in place for a while, and we're using it with COVID-19, and it seems to be working pretty well. That system will notify the local boards of health. The local boards of health then will call the patient, and they conduct the interview process, where we basically go and find out who are the close contacts, where have they been, what are the exposures, do the symptoms, are they consistent with this? And so then the Board of Health will notify close contacts, and they'll put all this updated information back into the MAVEN system so that if anyone else is checking it, all of that information is there. And then each of those new close contacts become what they call a PUI, or a person under investigation. And so a lot of times those are asymptomatic people that had a close contact with that first symptomatic individual. And so they were usually first notified by the Board of Health. And the patient undergoes a quarantine period where, because they were exposed but they don't have symptoms yet, and those symptoms could take up to 14 days to show, they have to stay quarantined and not have contact with other people until either the symptoms develop and then they become a person that does have COVID-19, or they are released from quarantine because 14 days have gone by with no symptoms. And they might be tested, they might not, but if there are no symptoms, they are released from quarantine at that point. There's also another class of people that are asymptomatic and that have a positive test. And I think right now the recommendations that we've gotten from the state and the CDC is that they should be isolated for 7 days. And if they have no symptoms, then they can be released from this kind of home quarantine. And I do want to point out that, actually, if you can stay on that slide for just a little bit longer, sometimes the doctors skip testing. And this is important because testing is limited. Sometimes the doctors assume it's COVID-19 because it fits in with the pattern and the exposure history they use their medical knowledge and the evidence to decide what to do. And they'll obviously tell the patient, what the proper course of action is in that case. Usually it's telling the patient to isolate, and sometimes those cases are not reported into the state labs in the MAVEN system. And if that's the case right now, then those people might not be tracked as part of the state cases. And so,
Nathan, can I just jump in on that?
Yep.
Yeah, sure. So this is Alan Ehrlich, member of the Board of Health, also a physician at Reliant Medical Group. And the patients who don't get tested tend to be ones where there's a high probability and their symptoms are relatively mild. Anyone who's getting hospitalized is going to get tested. But if someone has a cough, maybe their spouse was positive, and now they've got a cough and symptoms, the management is going to be the same, which is stay home, self-isolate until you either get more sick or get better. And so those are the types of patients who don't get tested.
Thank you. And the last thing on this slide was that up in the top corner of the slide, when we started out in this epidemic, the CDC was involved in that there were certain areas of the world, China and I think Iran, where the CDC was notified of every single person that traveled into the United States from those countries, and the CDC would then notify the local Board of Health. Since then, I think the travel has been stopped to those few countries, and we now no longer get any notifications from the CDC about any travel. So we are still relying on people either going to the doctor or self-reporting that they've had, travel or exposure issues. And so this is one of the things that the local boards of health are trying to deal with, is this kind of, sometimes we don't have all of the information that we need, and we're using the doctors and the state labs to notify us of people in town that are affected.
Nathan, this is Shelby. Can I ask a question?
Yes, you can.
Could you talk to us a little bit about the process once the Board of Health contacts the patient that is tested positive, and what's the follow along conversation that the Board of Health is having with that person during 14 days, or in the case of the asymptomatic positive person during the 7? Is there a constant check-in? What is that process? And again, we would all hope that a person testing positive or even negative with symptoms or no symptoms would do the right thing and stay home. But what's the Board of Health's responsibility, and what are they doing to follow up? Thank you.
Nice question. Yeah, actually, if you want to, and then I'll jump in if there's anything I can add.
So people who are either test positive or under quarantine, we have active monitoring. So we at least call them once a day. We ask them to take temperatures. We ask them about their symptoms. And, we give them a sheet that the state has given us as far as what their responsibilities are as far as quarantine and or isolation, depending upon which they are. Just so people know, someone who is confirmed is put in isolation, while someone who is a contact who may come down with symptoms, who is not sick yet, is someone who's quarantined. So people use those interchangeably sometimes, but there's a difference. So we are actively monitoring anyone that we are made aware of that is either someone that needs to be quarantined or isolated, and it's a daily conversation with them.
Thank you, Steve. So Steve Bakari is our Director of Public Health. He's the one who actually is reaching out to a lot of these patients, and he's done a lot of hard work. So thank you, Steve.
Sorry, it's Sayed Hashmi. Can I just add something to that?
Sure.
So this is Sayed Hashmi. I'm also on the Board of Health. I'm also a member of the Board of Selectmen. And the point that both Dr. Walsh and Steve are making is actually, to anybody that's listening, is key. It is critically important that if you have traveled to a high-risk area or you're concerned, that you reach out either to your healthcare provider or to the Board of Health. That is key, because what's going to eventually stop this pandemic is stopping transmission. And we need to know, if you've been exposed or not.
So I have a question. This is Lee Emery. So if you are sick, like you have a cold, or you think it's your allergies bothering you, sort of that level of illness, so you have a cough, stuffy nose, no fever, but you don't feel quite right, should you call your physician first? Or if you live in town, should you call Board of Health? And if you just have a little cough, like a little tickly cough, should you just wait until it blows up into something?
So I would say that if you're concerned about your health, you should definitely be calling your doctor.
Okay.
If after talking with your doctor and you feel like your doctor either is not responding the way you want, or if something else is going on, or you have some sort of larger symptom that you think the Board of Health should be notified about, then I think it's appropriate to let the Board of Health know. In most cases, what the preferred course would be that the doctor, is taking it seriously. They're getting you tested, and that test then goes through one of the approved labs that will then enter it into this MAVEN system. The workaround is that we can add people to the MAVEN system manually without a test, but we'd prefer not to do that. I think the system works better if it's all done electronically and goes through the doctor.
I'd like to elaborate on that. So, Lee, your question is very interesting, and what I would say first and foremost is there is no single answer to it, in that a lot depends upon risk in the first place. Or have you traveled somewhere that puts you at increased risk? Are you of an age that puts you at an increased risk? Have you had an exposure that you know about? And some of those things might prompt reasons, as Nathan had previously mentioned, to reach out to the Board of Health. Other of those things would prompt, talking to your physician. What I would say is talking to your physician, you will never go wrong, speaking as a physician. And it's better to call and get advice than to just go to an emergency room or an urgent care center. First call and get instructions on what you should do. And I think that would be general advice from all medical people around that.
So this is Selectman Edinburgh. I guess my question is, if someone has symptoms and they speak to their doctor and the doctor says, we're not going to test you, assume that you have COVID-19 and isolate. You mentioned that the doctor may not report that through the MAVEN system to the Board of Health. But if I'm in that situation and I believe I might have come in close contact with someone in a high-risk group, should I contact the Board of Health or ask my doctor to do that, just so the contact tracing can be done and people can be protected?
So I think if the doctor has told you that he's diagnosing you with COVID-19, then letting the Board of Health know is appropriate. I think that if they do it correctly, they should be entering it into the MAVEN system, and it should get to the Board of Health anyway, and then the Board of Health will end up following up with you. But if you don't hear from the Board of Health and you've been diagnosed with COVID-19 by a doctor, and it's been a couple of days, you could reach out to the Board of Health, yes.
Okay, thank you.
So if we want to go on to the next slide, one of the things that has come up is that the abundance of test kits is limited. The state health labs in particular have a limited bandwidth in terms of the number of people that they can test. And so what they've done is created categories of people. And those people are prioritized for testing. So the most important category for the state health labs are in blue, and those that fall in the bottom two categories, categories 7 and 8, are places that the state health lab at this point will not test for, but that other testing clinical labs will be able to test for at their and the doctor's discretion. So category 1 are healthcare workers, EMTs that have had direct contact with a symptomatic individual who is having symptoms during that contact period. And that healthcare worker has either a fever or any other respiratory symptoms. They do have to rule out the flu first. So this is actually, this type of testing then puts a large demand on the flu test kits. And in fact, I've heard from some providers that they're running low on flu test kits at this point. The second category of people is people who have had close contact in a congregate setting of COVID-19 with a systematic individual and has numerous other contacts. And so a congregate setting in this case is like a school, a long-term care facility, a prison, places where people are bunched together and really can't move easily in and out of that setting. They have to have a fever or symptoms like cough or shortness of breath. in order to be categorized as number 2. Category number 3 are patients that have been hospitalized because of their respiratory symptoms and have fever and have severe respiratory illness without any other explanation. So as you can see, these are all very stringent categories. Category number 4 are congregate settings where there is a cluster of acute respiratory illness that includes 3 or more individuals with fever and symptoms, and flu has been ruled out. Category number 5 is when you've had close contact with a symptomatic individual who has been diagnosed with COVID-19, and you have fever and you have symptoms and the flu has been ruled out. So category 6 is if you've traveled to a level 3 area, and these are listed on the, I believe the CDC and the US government website, areas with travel restrictions in place, and you've had symptoms within 14 days of that travel. And you have fever and symptoms like cough and shortness of breath. So those are the only places, categories 1 through 6, that are being tested by the State Department of Health labs. The doctors, though, at private hospitals and clinics are allowed to prescribe testing for patients that have just traveled to areas with community spread. And I think at this point, most of the country is listed as areas with community spread, and the patient has fever or mild respiratory illness. And then category 8 is a kind of left to the discretion of a doctor. It's a medical decision. And usually it revolves around whether they have some sort of risk factor, like they're older, or they have some other comorbidity health problem. And they also have fever or mild respiratory illness. So categories 7 and 8 are a little bit more broad. They give the doctor a little bit more discretion, but the insurance companies, the testing places, and the doctors all have to agree that testing is appropriate before testing will actually be approved. So even though people might hear about drive-through facilities and places that are giving tests, you actually have to have a doctor approve it, and you have to have it go through all of the proper channels before you can actually get a test. And so we are, as testing becomes more common, as we get more kits rolled out and more staff doing this, and we have actually had great luck with Quest and LabCorp and a large number of other places that have come online with testing, we expect that some of these restrictions will be relaxed, and that we'll expect that those people in categories 7 and 8 will actually be able to get the testing that we want. But right now, this is kind of what the current guideline is as of March 13th.
Nathan, this is Ian. That was going to be my question. I think you may have answered it, but notice that in results they talk about the state lab, and then they talk about these private labs.
Yep.
And the private labs now are exceeding the number of testings that they've done in the state lab. But these, I guess, this prioritization still holds true even for those private labs, or?
So the private labs are not necessarily regulated in the same way that the state health labs are. So what the state health labs have done is provided this as guidance, and the individual labs can use this guidance, or they could use their own discretion. So for instance, they might test their own workers, they might test their own patients over and above, let's say, testing of healthcare workers from some other community. They're allowed to kind of set their own ground rules. The insurance companies are allowed to weigh in and say that certain people are, approved for testing or not approved. And the doctors themselves might look at certain patients and say, this one really needs a test where this one doesn't because of some other risk factor that's up to their discretion. So there's actually multiple avenues that come into, who gets a test. And at the private clinics or with the, any of the clinical labs, it's up to their own policies. But most of them are following some sort of prioritization, and most of them are somewhat in line with the state health labs.
So Nathan, to that piece, because I know it's been some questions out there, individuals in the community that are asymptomatic but just concerned and want to get testing, again, it is not something that, as you said, you go to the drive-in center in Shrewsbury, you go someplace to get testing at this point. It really is, as you said, going through primary care or doctor, and you need kind of that recommendation to go to a testing site.
I think you said it pretty well. There's a lot of what they call worried well, and those people are people that are asymptomatic but are concerned. And at this point in time, the testing facilities haven't kind of kept up with demand. But what we can see is there's actually a rapid escalation in the number of tests that these private clinical labs are doing. And so we could very well get to the point where we meet the demand and then we can actually start testing people that are just worried without any symptoms.
Nathan, a couple questions for you. I didn't know there was, well, I'm not aware of a state testing facility in our area. Can you give us an example of what one would be and where they are?
So the state public health lab is in Jamaica Plain, and it serves the entire state. And so doctors that are collecting samples and sending them to the state lab, they basically have to fill out a form. They used to have to actually contact an epidemiologist and justify it. They've dropped that requirement. If you meet one of these 7 categories, you can actually just write that on the form and send it directly to the state public health lab. But it does require transport time, and so it does add a little bit to the delay. It's kind of why it's that 24 to 48 hours. And then there's a little bit of extra time for those records to get put into Maven. Sometimes the doctors actually find out a little bit before it's in Maven, so it's possible that your doctor might tell you the results before the Board of Health contacts you. But we try to keep us moving as quickly as we can.
Okay, and the prioritized list that we're looking at, is that actually a ranking? So 1 precedes 2, 2 precedes 3, et cetera. Those numbers are intentional.
I believe that is the case, yes.
Okay, and then my final question on the slide is, it's interesting that this is Massachusetts guidance for testing. So because folks are in the country are still in, and actually from other places in the world, able to come and go across our borders, state and national, are we to assume that this categorization or prioritization is potentially different in New Hampshire, Rhode Island, Tennessee, et cetera?
I believe that because these categories have changed within Massachusetts, even in the past few weeks, that I would believe that there probably are differences from state to state. This guidance, I'm only familiar with the Massachusetts guidance, so I can't really speak to any other states' priorities.
These are guidelines specifically from the CDC and national guidelines, and they are Massachusetts guidelines.
These were coming from the Massachusetts Department of Public Health. They may have gotten them from the CDC. It looks like Alan wants to say something.
Yeah, I believe these are consistent with the CDC guidelines. They're an adaptation of it, but they're consistent with them. So, you would expect relatively similar approaches elsewhere. Now, what I would say is, if you ask about what's happening in New York City, where it's really, very, of epidemic proportions there, they may have different procedures, and that may be changing on a moment-by-moment basis. And again, it's affected by, do you have adequate swabs? You asked earlier, is this a prioritization 1 to 8? Well, if we have adequate swabs, and these are the indications would be a better way of putting it. But if you have a limited number of swabs, I think particularly 1 through 6, if you're in any of those buckets, they're going to try and test you. But, again, a lot depends upon how sick you are. So.
And to add to what Dr. Ehrlich had said, this is Syed Hashmi from the Board of Health and the Board of Selectmen. To answer Selectman Marshall's question, elsewhere in the world, for instance, Singapore, Taiwan, Hong Kong, and South Korea, they're not limited. They went all out and expanded their testing. And so they identified those cases, isolated those cases, did tracing and quarantine. As Dr. Ehrlich has said, we are limited by the testing supplies that we have, and the rollout has been delayed. So that is affecting our ability to capture who's infected and who's not.
I do want to add one other point. Nathan, Dr. Walsh had mentioned that you typically get results in 2 days, maybe 3. The FDA has approved, and there are some testing centers in Massachusetts that are using a type of test called PCR, or preliminary chain reaction, that can give you results in 45 minutes. So we may start getting that. That's still limited, so don't, you have to deal with whatever your healthcare system has available, but that may ramp up both the testing and the rapidity with which results are returned.
Yeah,
I have a question.
that happens.
I have a question.
Sure.
Lee Emery. This may have to do with the severity of the patient, how badly they're really feeling, but they called their doctor. The doctor says it does sound like you should be in the hospital. Proceed to the emergency department. Is it, if the patient feels well enough to ride in their own car and avoid contacting the emergency people in the ambulance, is it better to go in your own car? Or is it worse because then you walk in the front door of the hospital instead of into a more sequestered area?
You want me to answer that?
You want to answer that, Steve, or you want me to?
You can. Go ahead.
Sure. So first, it depends upon how sick you are. So if you
Right.
are, short of breath, you're having trouble breathing, then you need an ambulance, and that's the end of it. I mean, no one should risk their health because they didn't want to call an ambulance. But if somebody is perhaps just feverish, they're breathing okay, but they're feeling weak, and a family member can drive them, that often is okay. The doctor should be guiding you on what mode of transportation to take. But not everybody who might have COVID-19 needs to be in an ambulance, if that's a better way of putting it in regards to your question. So first and foremost would be to ask the doctor what's the best way of going. And then if a private car is used to transport, one can go to the emergency room, have somebody go in who is not the patient and say, listen, I have somebody in the car, I was directed to come here, and what do you want me to do? Typically, doctors call ahead to the emergency room and let them know about patients they're sending, so it should be a coordinated effort.
Right. I thought that's what you would say, but I think it's important for people to hear that. And if the doctor doesn't say it, ask your doctor, should I go by ambulance or drive my car? So you're sure you get clear direction.
Steve, do you want to add anything to what I had said?
Yeah, the only thing is our EMS is screening patients right now as you call, so they will ask you questions so that the EMS personnel can be properly protected if they think that, you may have coronavirus.
Good. So I think we're out of questions on this slide, so we can go on to the next one. One of the things I wanted to touch on was the CDC has listed some return to work criteria, especially for healthcare professionals. And this differs a little bit than, the guidelines for just being done with home isolation. So I'll try to talk a little bit about the difference between the two of them. I do want to point out that all non-essential businesses have ceased in-person operations at this point in time, according to Governor Baker's order. And one thing that I did find in their description on the CDC criteria was that decisions to discontinue home isolation are made at the local level by the local Board of Health. So that does give the local Board of Health a fair bit of leeway in us trying to interpret these CDC guidelines. But for the healthcare professionals, there's basically two ways that they have advised people to return to work. And in the first case, if there has to be resolution of the fever and there has to be improved respiratory symptoms, and then they need 2 negative tests, COVID-19 tests, that are at least 24 hours apart. And so those are the criteria that they're using to assess, whether people come back to work. The other way, because the first way requires use of COVID-19 tests, which are limited, the other way to do it is by a time-based method. And here what they do is they look at, you have to be at least 7 days from symptom onset and 3 days from symptom resolution. And at that point, healthcare providers can return to work with a mask. And at this point, also 7 days from symptoms onset and 3 days from symptoms improvement, others may end home isolation. And I think I have that part right, but other people will comment if I have that wrong. And then for the healthcare professionals, after 14 days from symptom onset and all symptoms being resolved, those healthcare professionals can return to work with no restrictions. And so one of the things that the Board of Health is going to have to discuss tonight, and we don't have to do it right now, we can wait till after the slide deck, but we're going to want to talk about what do we use for town employees returning to work. when do we want to decide when it's safe for them to return? So let's postpone that question until the end, and let's go on to the next slide unless there are questions about this. I do want to talk a little bit about the, so a lot of questions that people have is, oh, who's infected in town, and why isn't the Board of Health giving us all the information that we might want? And there's a something called Hipaa. A lot of people are familiar with it only because they keep getting like handouts at the doctor's office when they go in, that they have to sign some extra forms, and it relates a little bit to Hipaa. But the Health Insurance Portability and Accountability Act does a lot of things. One of the things it does is protecting patient privacy. Information can always be provided to a public health authority, which includes the CDC, the State Department of Public Health, and the local boards of health. This can be done without patient permission and can just be given to us. Information that's released to others has to must be the minimum amount of information necessary to accomplish the goal. So information can be provided to people at direct risk, like close contacts. Information can be provided to people that are involved in the care of a patient. And so the Board of Health does release address information of COVID-19 cases to our EMS. But you can see that what we're doing is a very, very limited type of information. We're not giving out names, we're not giving out ages. It's a very limited type of information. And this is to comply with Hipaa. We are, even though we're in a state of emergency, the federal government and the state government have made it very clear that Hipaa is still in force and that we're not allowed to violate it in the emergency for just general routine release of information. And the other thing that I want to point out is that, well, you might hear more detailed stats about like the United States or even people in Massachusetts. For instance, information like a female in her 20s would travel to Italy, returning on February 15th, was diagnosed with COVID-19. That type of information at the state level, because the state is so large, there's still a large number of people that could fit that description. When we start talking about a Westborough resident, that same information might actually allow somebody to figure out who the patient is, and therefore it becomes personally identifiable information. And so as a town or a Board of Health, we have to just be extra careful about the types of details we release. And this is especially important when there's only a few cases of COVID-19 in town. As the number of cases increase and we want to start putting out more general information about how many people are in each category, it's no longer personally identifiable. But for the first few cases, it's actually important that we be just a little bit tighter with the details we release. If we can go to the next slide. I want to talk a little bit about Massachusetts cases.
Nathan?
Go ahead.
I just wanted to make one point on the last slide, which is that Governor Baker has issued a directive indicating that the Board of Health is allowed to share information with first responders in order to protect them. So, that again is another area in which the HIPAA may not specifically apply.
Yes, thank you. And that was, I think, what I was trying to break out, but didn't do so clearly, in that we are sharing the address information, and that's what has been deemed acceptable to still comply with HIPAA, but still meet this kind of, very specific need of our first responders. So in the cases of the state lab, the number of positive cases, the Massachusetts public health labs have still detected more cases than, some of the other labs. This data, I think, is from March 23rd, so it's, not today's data, but it's, reasonably accurate from the time frame. You can see that the total number of cases that we've been tested is approaching 9,000 as of this day, and the total number of positive cases is 777. So I would say that we're screening about 10 times as many people as are positive, which is much better than where we were when we started this outbreak. But I still think I would personally like to have more cases tested. If we get up to like 20x the number of positive cases, I would certainly feel better that we're approaching this, identifying all of the contacts of people that are infected. What I threw up there is a map of Massachusetts and each of the different counties and how many cases have been positively identified in each of those counties. Worcester County, we have 42 people there. And so, you know, it's not a super high number compared to some of the other counties. And Massachusetts has released some data of demographic information about the sex and the age groups. And you can see that male and female, it's split fairly evenly. And as far as the age groups, they're kind of broken mostly into 10-year brackets, except for the youngest age group, which is 0 to 19, and the last bracket, which is greater than 70. And in terms of the number of cases in each of these 10-year brackets, they're roughly equal, although I think it kind of peaks with the population size, maybe. But, you know, it ranges from 100 to 150 in most of those categories. In Westborough, and this, Steve may have to jump in and correct me, but I believe that we have 3 residents that have tested positive for COVID-19. I think they are all isolating themselves in their homes. And I believe that we have 1 town employee who does not live in town, and so he's or she is being isolated outside of Westborough. Is that incorrect?
Do you want to speak to what about the healthcare facilities? What's the criteria there if there are cases in those healthcare facilities? Do we get notified about those, or what happens to those cases that are in our, for instance, nursing home long care facilities?
So back on that first slide that I had, if someone is diagnosed in one of those long-term care facilities with COVID-19, it should get entered from their doctor and should go into Maven, and then we would find out about it as a local board of health. For anything that happens here in Westborough, for any resident here, it should come back to our local board of health. If someone is tested outside of Westborough and or they live outside of Westborough and let's say work in town, we may or may not get that information because it would go to the local board of health of wherever they are currently residing, I believe.
Dr. Welch, this is Lee. Is there any information you can share about the residents or the town employee that may help us understand where they got it? Like were at the biogem, or had they traveled, or there's absolutely no idea? Just like, do they get it Roach Brothers? They think, I mean, is there sort of anything that would help us be more careful about what we're doing?
So I have to be real careful about what information we are not allowed to release. I think that the general consensus is that the majority of cases, there was some travel history. And if Steve feels comfortable giving any more information than that, I'll let him address it. But that's kind of about the point that I think I'd feel comfortable with only 3 cases.
Sure. So, you know, I'm fairly positive that 2 were travel history and the other ones don't really know. So that's about as much as I want to say about that right now.
Thank you.
If we start to build up more cases, it'll be easier for us to then say, oh, you know, 10 of the cases were this, 4 of the cases were this, and 5 of the cases were that. And we wouldn't really engender any, you know, particular people. But I think with only 3 people, it's just such a small number that any sort of comment more than that starts to get into patient privacy. But at this point, we don't see large, widespread community spread in Westborough. You know, we don't believe that these are all because everyone attended, you know, a Freedom Park rally or something like that. We think that most of these are coming from outside at this point.
Thank you.
So Steve, you didn't have anything else, right?
No, not at this point.
Okay. So actually, if we can go back one slide, there was a few things I wanted to finish here. So currently, the Westborough Board of Health currently releases really just the number of confirmed cases. And one of the things I think that we'd like to discuss a little bit tonight is what we report and how often. And so that's one thing that we'd like to you know, discuss and see if we can come to some sort of agreement. As we get more cases, obviously, it's more important to keep the town informed. We've been lucky so far that we've only had so few so far. So we can go to the next slide. I kind of wanted to highlight where Westborough stands. I kind of wanted to do cases per million residents. So this is kind of like a per capita infection rate. And there's a country that's within Italy that's right in the northern Italy region called San Marino. And they basically have 4,500 cases per million people. And so this is the area of Italy that's being overrun. Their hospitals are swamped. The next highest case is Washington State. When I pulled these numbers, there were 2,200 infected people or COVID-19 positive cases out of every million residents. New York City is 1,500. Iceland is 1,200. New York State, even when you factor in all of the rest of the residents in New York State, they're still at 800. To put in perspective, other countries that are listed as kind of critical are Italy, Switzerland, Spain, Iran, Korea. Those are the numbers for those countries right now. And so Westborough is listed at 160, and this is just mostly because our population is so small. When you have a population of about 20,000 and you have 3 cases, that automatically just jumps you up by factors of 50 every time you have a new case. So I wouldn't worry too much about where Westborough's number is, other than we don't really want that number to get any larger at all if we can help it. So we do want people to, reduce contacts, not go out and socialize in groups. Do as much as you can remotely. We need to keep our number down. If we compare Westborough to Massachusetts or to Worcester County, Massachusetts is at 76 people per million residents, and Worcester County, where there were only, I think, 24 cases, it was at 52 cases per million. Japan, which was able to stop their spread of the epidemic pretty quickly, they're only at 8 cases per million people in Japan. So we really need to do a better job of reducing the spread of this virus within our own community, within our own state, and within our own country. So this is kind of just some numbers to kind of make people aware that, it's important that we maintain social distancing and not treat this too lightly. And so this actually, I think we don't need to keep up on the screen. This was mostly that stuff that we wanted to, in case we wanted to go into it as we discussed stuff. So I'm going to kind of hand this off, I think, a little bit to Alan and Syed to try to figure out of the issues that I mentioned in terms of discussing where their feelings are on some of those issues.
Do you want to just start with the discussion on the when we're going to release people back to work? I think that's especially for town employees, because that is a critical discussion. Do you want to do that first?
Maybe we can pull up
can you turn up your microphone, Syed?
Okay. So, Dr. Walsh, do you want to just discuss the going back to work for town employees?
Yes, I would like to. Is it possible for us to go back to the slide deck that has that slide on there?
Give me 1 second.
I was hoping that you could pull up the slide deck and go to this slide where we were talking about return to work.
And Nathan, remind me again, if we have a positive contact in town, right? We're tracing, and Steve, feel free to jump in. If there's a positive contact in town, we're informing the coworkers if there's been exposure. Yes, am I right?
Okay, so there's 2 things. When we do our follow-up, okay, we always go, from the case, we go to close contacts, and there's a certain definition of a close contact, which is, being within 6 feet for generally 15 minutes when they're symptomatic. So we reach out to all those people and they are quarantined. And if they live in another town, we reach out to, the Board of Health in that town and tell them they need to actively monitor those people. So anyone who's a close contact, identified as a close contact to a positive case, they are being quarantined and actively monitored by the Westborough Health Department, which means I call them pretty much every day, ask them their temperatures, their any kind of respiratory symptoms, those types of things. And then at the end of 14 days, if they're fine and healthy, we would release them from quarantine. As far as the isolated person, who is the person who either has a negative or a positive test, or it has symptoms and is a close contact to someone who might be positive, which we're just assuming is positive, there is a time, a time strategy to release them, and this is probably what we want to talk about. So, as Nathan had said, it's 7 days. They have to be isolated for 7 days from the onset of symptoms, and they have to have 3 days. 3 consecutive days of no fever and improved respiratory symptoms. And that's the guidance we're given from the CDC right now and from the state as far as releasing people who are not healthcare workers back into the, back into the workforce, or releasing them from isolation. So that is what the state and CDC is recommending now for people who are not healthcare employees.
Thank you, Steve. That's, I think, very accurate. And so we have to now decide, obviously, the local boards of health, we could have stuff that is more stringent than the state or federal guidelines if we wanted. We can also be in line with those guidelines. And it may depend a little bit on what the person's role is as a town employee. Obviously, town employees that are working from home, they can continue to work from home while they're in isolation. This is about people that would have to be coming back into a public building or interacting with either other town employees or interacting with the public. And we have to kind of decide for those people in town, how do we want to handle them? What would our recommendation be? I believe that what I would like the Board of Health to do is to give a recommendation, and then it might be either the town manager or the Board of Selectmen that may have to act on our recommendation for how this gets implemented. But I'm not a lawyer, so having someone else comment on exactly the process, I wouldn't mind that. But I think we can still give our recommendation as a Board of Health.
Could I just jump in for 1 minute, Nathan?
Sure.
So one thing I think we talked about earlier is that vast majority of town employees do not live in town. So I am not the one doing the isolation or quarantine follow-up for those people. So again, it's the local Board of Health or local health departments who are the ones that can release people from quarantine and isolation. So if you had an employee that lived in Grafton that didn't tell us they were positive because they don't have to tell their employee, we would not know. And if Grafton is going by the state rules, they would release them, and there'd be no way for us to know that person, if we adopted rules greater than what the state and CDC have recommended, there's in a lot of instances, there's probably no way of us knowing that, whether they were quarantined and or, isolated. So just one thing to remember, that I don't get reports of every employee that tests positive and or is quarantined.
So on that point, Steve, I think there are limits to what we would want to do anyhow. I'm not worried about the general case of town employees personally. What I do worry about are the first responders, and first responders go to lots of critical situations that don't involve COVID-19. Someone's having a heart attack. Someone is in heart failure and needs to be transported by ambulance. These are people who are at high risk. So my feeling is that we should recommend that we consider first responders the equivalent of healthcare providers for the purposes of return to work. So if they come back to work, after 3 days of symptom resolution, that they wear masks while working and things like that. But that would be my suggestion. And I don't know if we have anyone from police or fire here on the call, but I'd be more than happy to hear their input on that particular point.
So thank you, Dr. Ehrlich. That's also the way that I'm leaning. I'd love to hear from Dr. Hashmi as well.
I'm okay with that. My concern is, the only concern that I have, and you're right, the first responders are like healthcare, but the thing is, there are people elsewhere in town that do interact with the public. Now, granted, some of that has fallen off because the town is now closed, right? So, Christy, can you jump in? I mean, am I right? The volume of interaction with the general public is now extremely limited. Would that be correct?
No, that's why I came off mute. So all of the staff is especially following the governor's order yesterday. Everyone who can work from home is working from home. There are a few essential employees that are going into the office on a very reduced or alternating schedule. And so it really would be first responders. We do have, the Department of Public Works is considered essential under the governor's order. And so they continue to work, but they are also working on a reduced and alternating schedule so that they're not all together at the same time. But, certainly their interaction with the public is much more limited than the first responders. So, I think that our biggest concern would really be with the first responders who are still actively operating, every day with the public.
Yeah, I mean, maybe we want to try to have two classes, one being town employees that interact with the public and one group of town employees that aren't expected to interact with the public and maybe have different criteria for that. Because it's really those people that have lots and lots of contacts that are the ones that are most at risk of becoming a problem in this spread of the disease, whereas those that have very few contacts are less of a risk of, making this a lot worse.
So
sorry, go ahead.
What Steve said, we have had employees, talk to us certainly about any symptoms or concerns that they have, but we can't require them to. And especially now that they're working from home, we might not know. And so, the employees that reach out or the employees that let us know, we work with Steve. Actually, Kim, who's also on this call, works directly with Steve on each one of these cases with our town employees. So, I think Steve's concern about creating a level or guidance that's more stringent than what the CDC is recommending would be very difficult for us to enforce. Though I do think that treating first responders like healthcare providers makes sense.
Yeah, Christy, I was just going to jump in. I guess, Dr. Walsh, what you had talked about, I want to make this as simple as possible for folks. And I guess when I look at it, I don't know, nor do I think we should try to figure out which town employees have less. I mean, I think every town employee has the potential and capability that they're interacting with the public. They are all public employees. So to me, I'd say I'm going to defer to you guys. I mean, this is, and I think, to your point before, I really think this is a Board of Health call. If you need the Board of Selectmen to, ratify, I don't know that we need to. I really look at the Board of Health for leadership here, but I guess my comment here would be, I absolutely agree with treating our first responders as if they were healthcare professionals. I think the way they operate in a lot of circumstances, I would deem them that way. And then to the second piece on other town employees, I would just ask for consistency there, because I do think it could get overly confusing if we try to, identify, because then we have to go through every single town employee and say, okay, is this person, not with the public as much or not? I think it'd be easier to just say, hey, for all of them, here's what it is.
I'd like to just chime in. We've been talking about first responders in part, and I had started that because of their interaction with the community. But there's another aspect that makes first responders very much like healthcare personnel, which is that they work closely with each other. And if one of them gets infected and infects several, then all of a sudden you have an entire department that's down. And that can be very dangerous for the town. So I do view first responders really completely different than other town employees in that regard, given the critical nature of their work. And so, and apropos of what we've heard, I think just focusing on those roles would be, I think, the cleanest and clearest message we could give. And I think it would be effective at what we're trying to achieve.
Thank you. I just wanted to respond to a couple of the comments that people have made about the fact that we, as a Board of Health or a town, we might not get notified of all of the cases, especially if people live in other towns. We're currently living in a world where there's a lot of government advisories where they're not necessarily enforced, or even when orders like in New York City are put out, the ability to enforce a lot of these things are not necessarily there. They might lack the teeth, but what the board is doing with any sort of guidance that we put out is to try to set what the norms for behavior are, so that people know that this is appropriate behavior. And even if it's very hard to make it so that 100% of every employee is categorized in the right way, if people know that they're essential and that, it really should be 14 days from symptom onset, to try to jump back into the game to get back to work in 7 days and put people at risk, they should be aware that they're only hurting the community by doing that. And while it might be hard to enforce because we might not have all the data about everybody, I think if people are aware of the policy and they're making their own choices, I think people are actually pretty good about making good decisions. And so I'd like to give people a little bit of faith and a little bit of trust to be upfront and honest and honest with themselves, even if they're not telling their employer about things, to make the right decision. I mean, this is kind of like if you're sick, stay at home. That's what we had done at the very beginning of this epidemic. We made that very clear that if you're sick, stay at home. It's not like we were enforcing it. It's very hard to enforce if somebody is feeling lousy that they should be staying home, because it's hard for an employer to know if somebody is feeling lousy. But what you can do is you can set the right tone. And so I think that, Alan, I think you said it very well when, you described our first responders really as healthcare providers. And so with that, I think that's where I'm leaning. And if maybe we want a motion at this point, or we could still have more discussion.
I just want to answer a question that came through, which was, the question of whether pathway 1 with the 2 negative tests is really an option for, let's say, our first responders because of the limitation on the number of tests and test kits available. I think it is an option. In particular, the governor has made a point of referring to the testing at the CVS in Shrewsbury, which is dedicated for first responders. So I think that would be an option that we could take advantage of if that were appropriate. So I just wanted to answer that question. And then I would actually like to make a motion, which you get more discussion afterwards, but just to have it on the table. And so my motion would be that we consider first responders, meaning police and fire and ambulance crew, as healthcare providers for the purposes of return to work policies. And given that we ask the town to, or we advise the town to adopt the CDC standards.
Good. Syed, do you have any discussion before we vote on that?
No, I second that. And Alan and Nathan, would you be okay with the 2 negative tests 24 hours apart, or do you want to go with symptoms onset?
Oh, no, I believe that this should be either or. If they have 2 negative tests 24 hours apart, I believe that is a sufficient standard to release somebody back to work, healthcare provider or not.
So let me just chime in on the rationale for the 2 different approaches. And the rationale is that even after people get better, they can still shed virus. So you may feel you're completely fine, but there'll be virus that can be detected by very sensitive means in your secretions. And we're not completely clear what that means, whether all those viral particles are infectious or not. But we do know that can last up to a total of about 3 weeks. Not everybody does. So if you take the approach of just being safe, you're on the bottom scale where it's 3 weeks from symptoms, you're all better, but maybe you'll still cough once in a while. And so you have a mask, and the mask is there to protect other people from your secretions. On the other hand, if you are no longer shedding any virus and you have no symptoms, then you don't need to wear the mask anymore. And that's what the 2 negative tests are doing. 2 negative tests 24 hours apart says this person has stopped shedding virus. And maybe you stop shedding virus in 2 weeks instead of 3 weeks, and it allows for that set of circumstances.
So I believe that at this point we need to do a roll call vote. So Dr. Ehrlich?
I vote yes.
Dr. Hashmi?
Yes.
Dr. Walsh? Yes. So with that, the motion is passed. I think there was one other item, Ian, if we still have time, and that is kind of to talk a little bit about how much information is released and when. And I think, Alan Ehrlich, you had put together something for us. I believe it's the very last slide here. And if that's not appropriate, you can, wave that away, I guess.
No, I think it is. It's one more slide. If someone can advance, keep going. Should be. I know I saw it. That's it. This has an introductory part that addresses the need to balance information for the town and privacy of affected individuals. And we thought that it would be important for the town to have information about what's happening at the local level that is separate from getting the more global information. And at this point, given the amount of cases that we have and the what I expect to be the cadence of things, I think probably a weekly report would be okay, although we could do it twice weekly if that were helpful. But the idea here is that Steve, as the Director of Public Health, would develop a report that would be shared with the Board of Selectmen and could be posted on the town website that identified information of interest about Westborough. And you can see what we have here. The number of new confirmed cases since the last report, the total number of cases to date, the status of any cases that have resolved. If it's resolved, you either have died or you got better. And if you've died, we would include some information that could be ultimately aggregated, such as age, sex, and whether any high-risk comorbidities are present. And this is information the state's currently providing in their daily report. Also, the number of people who have had their situation resolved and removed from monitoring is helpful. And then the status of active cases, how many are still at home and how many are hospitalized. And finally, how many people were monitoring for one reason or another, but they have not had a positive test. And then included with this would be regional data for comparative purposes, much as Nathan had provided in his slides. And so this is my proposal for what a report would look like. And I think this would be informative while at the same time protective of privacy of affected individuals. And so I put this out to my fellow board members for their thoughts, as well as the Board of Selectmen, who is one of the intended audiences for any feedback and comment.
So, Alan, I love the fact that you did this. One of the concerns is, and this goes back to the outbreak in New Rochelle in New York. And so my question is, do we want to break this report down by precinct? So, for instance, if all of our cases are clustered in precinct 1, right? Well, they're different because then we have, that's where the healthcare facilities are. I'm just saying this as a hypothetical, just as a hypothetical.
I think that's a good suggestion, but obviously it's premature when you're talking about single digits because you get a lot of random effects. But if we start getting into, God forbid, we have a larger amount where we're having 10, 20, 30 people in town affected, then that might be useful from a public health perspective. Again, I envision that the report would also have the ability for Steve to make commentary, and maybe that could be part of that if it's not formally tracked, at least in the beginning. And again, this can be changed over time.
Yeah, I would encourage. Yeah, so I'm okay with that. You're right. If it's single digits, you're right. I don't want error, and I don't want randomness. But I think geography is going to play a key role, and I think we should kind of at least try to figure out which precincts, because precinct is an easy way to identify where people are living, and it may be just something we need to consider moving forward.
One thing that I would be interested in hearing from is obviously telling all of this is going to take personnel and time, and it's time that they're not doing, for instance, contact tracing or other essential roles of the Board of Health. So in just a moment, I'd actually like to hear from Steve on his thoughts. But before he gets on, I do want to say that I was on the call with the Mass Department of Public Health today. And one of the things that they have done is started talking with some of the universities in Massachusetts that have public health departments. And what they've done is talk to the students at those universities in the public health department to see if they can mobilize volunteers to help towns like us, like Westborough, in doing contact screening. So they're starting the process of training up those students in how to do contact tracing and epidemiological research. And the thought is to have those people help out and maybe free up some of the bandwidth that otherwise right now is really tight. So if that works out, we might have some extra hands and extra help in doing this. I'd say with 3 cases, it's probably manageable, but obviously as this number goes to like 30 or 300, it will not be manageable with the staff that we have right now. So with that, Steve, are you still on the line?
I'm on here. Yeah, right now I can handle this. Like you said, if they get worse, it could become a problem, but I have the bandwidth now to put the report together. That shouldn't be a problem.
And in timeframes, if it was once a week versus twice a week versus every day, how much of a burden is that? Is it minor either way, or is it when we get to once a day, it actually starts to become tedious?
Well, I mean, once it's established, I could do it every day. I think it might be excessive at this point, but whatever you want, I'll do. I'll get it done.
I just wanted to be clear that the things on this list are things you're tracking naturally anyhow. I'm not asking you to do any extra work in that regard, but it's just a question of putting a report together. And again, I think with the current volume we have, once or twice a week makes sense. I don't think it makes sense to have a report the next day where nothing has changed.
Is this a report that you'd like to see on the website, where we might just be able to have Steve update some numbers on the website and then without an official report? Or are you looking for an official report that has like a timestamp on it that we then have kind of like the WHO has incident reports where every day they put out a new report and you can go back and you can look at each day. Is it something that we want just more fluid on the website, or is it something that you're looking for a formal
I actually
report?
would like a timestamp. Sorry. So I think I don't want to generate more work for Steve. I'm okay with, if things are, unless we have a huge spike in cases, I'm okay with the workload he's got. Getting a once a week report on a date we can decide, but I think it should be date and timestamp so that, we know, like,
So I'd like to give the Board of Selectmen a chance to give their input on this as well. It looks like Shelby, you're standing by.
Yeah. So my initial thought is I think twice a week seems reasonable at a schedule that makes sense. Probably not Monday, Friday, because then it leaves lots of work days in between, and puts burden on what are probably heavy days anyway. The other thing I would add, I'm not so sure. I'm not a epidemiologist or statistician, but I'm not sure that a timestamp on our website is important to the public so much as here's what the number looks like. I would imagine that Steve and the Board of Health will know when those numbers are being updated and when those reports are coming in. So I don't know that the public needs to see, 28 different reports. I think it's one report, and like with a little footer, not to get too granular, last updated on, and then that the public understands that. But twice a week would be great. I do think it's interesting over a period of time to potentially identify a precinct. That's a great suggestion, Syed. I would worry right now. I would worry about the implications of that in a number of different areas, which I won't go into right now. But I, as a suggestion, I might recommend to Steve that you're gathering that, so that's not something that has to be added after the fact. But should we need to add it, you already have that data at hand. Thank you.
This is Lee. I would prefer the Board of Selectmen get it twice a week, and I would like to get it before you post it on your website. The timestamp, I don't know if that's important or not. And just an aside, you may have already thought about this on who might help you with reporting. I wonder if the school nurses from Westborough could also be trained, or do you worry about them being too familiar with the people in Westborough and confidentiality?
No, I have already spoken to Amber about that. If it's needed, they have offered their services. So obviously that's a resource I have if we need it. So we haven't gotten to that point yet, but they were very generous in offering those services. So it is an option.
I would also chime in that they, as professional nurses, are well acquainted with the HIPAA and privacy stuff. They are dealing with all sorts of personal medical information of their students, and so they would be excellent choices, in my opinion.
Right.
So
I just didn't know if you had a concern about it. I mean,
no,
I'm a nurse, and
absolutely not.
all nurses are very well versed and compliant with HIPAA.
No, it's actually great in Westborough that the the town employees work so well with each other and are willing to kind of help each other out. I know other towns where they've had to, the towns have actually had to declare a state of emergency in order to allow the different town personnel to go work in a different department to help out in other areas that were important. And so it's actually nice that, Steve has a nice working relationship with the school nurses. They do a lot of programs together. We offer like school vaccinations and a lot of these joint efforts that, Dr. Ehrlich also has been involved in that really, go a long way towards strengthening our community by these kind of interactions. So thank you to all of the people that work in that fashion.
Yeah, I would just say, this is Ian. I agree wholeheartely with what Shelby and Lee said. And I do know in discussions with Christy, our town manager, and I know she's been in discussions with Steve. I mean, it's definitely something we can help with the updating of the website. If Steve just puts the data together, we get the reports as Lee indicated from the selectmen, but then updating it on the website. I do think it's something that our citizens of Westborough are looking for, and I think we should provide it. So full agreement with all of that, and that's it.
So it would be the simplest thing then for Steve to do is if he were to generate a report and was sending it to Ian, and then the Board of Selectmen took responsibility for updating the website. That might be one option.
We would definitely
how does that sound to you?
We will take that on. Yep, we agree to that.
That sounds fine to me. I'm sorry, Adam. Alan, were you going to say something?
So I was to say, yeah, I'm comfortable with twice a week reporting. At this point, until the rate of information or the rate of cases, hopefully we don't get there, would warrant more frequent reporting. But as far as agree with Shelby that track the precinct information for now, but I'm not comfortable publishing that until there were a sufficient number of cases where release of that information wouldn't cause people to assume anything about populations or communities or groups of people.
I think
not just the risk of identifying individuals, but want to make sure that as we share information, we don't stigmatize any groups within our community.
No, I think that's well put. We do track the addresses of the people. I'm not sure we convert addresses to precincts here at the Board of Health very easily, and maybe Steve will correct me if I'm wrong. But it might be that we want to rely on GIS or somebody in the town office that has a better ability to kind of map from address to precinct or other type of breakdown of the area in Westborough. When we get to that point, we may need additional services that kind of help with that. But we have all the address data.
I would hope that we can do that within either the Board of Health or with whatever help we get, just because the more time you have information going out to different places, the greater your likelihood of there being breaches of privacy that you don't intend.
Alan, I agree with you, Alan. I was going to say, this is Ian. I was going to say the same thing. I do get concerned about spreading that out with the discussion about HIPAA. So that's fine. I think tracking it, we can catch up soon. I would just, well, I think it's a good idea. I know that when we have voting, many people, a high percentage of people in our town don't know what precinct they're in. So it's something we can do, but we get that question all the time. And, it's, I don't think we have to put it out there now. I agree with it, what Selectman Edinburgh said, but I do also agree with Dr. Ehrlich. I would rather not branch out to GIS or other departments. I just think that is spreading knowledge of the individuals too far.
Okay, I do want to say that when we go ahead and decide that we do want to see precinct data, there may be a delay from that decision as we try to convert from addresses to precinct numbers.
I don't think it'll be a problem. I have the manpower in the office right now. Just internally, we'll just take the cases and we'll start looking at a list of precincts, and we'll just internally map them out. So I don't think it should be an issue right now.
Yeah, and I believe
we'll have it.
yeah, this now I believe the town clerk can provide you an electronic file where you can look up the address and it'll in a spreadsheet and it'll give you the precinct.
I think that I think if you move forward with your vote, I think Steve and I can figure out how to get you the information you're looking for.
And Dr. Walsh, there's one other thing I wanted us to consider from the Board of Health. I'm speaking now as a member of the Board of Health and not as a member of the Board of Selectmen. I'm thinking as a Board of Health, as this epidemic is ongoing, and since we are now able to have phone calls, we can have meetings via phone. I would urge that the board consider holding a weekly standing meeting with Steve, on Tuesday at like 5:30 or something. And it could be just a brief meeting of where things stand, and it could be prior to him releasing the report. We get together, we just go over our concerns, where we stand, where we've been, where we're planning on going. And if nothing is there, the meeting will be short, we'll adjourn. But I think it would be helpful to have a standing meeting where all three of us can get together and touch base.
What about you, Dr. Ehrlich? What are your thoughts on a weekly meeting?
In general, I'm okay with it. I think it would be brief. And at this exact moment, I mean, it may only be a couple of weeks we need to do that, and then we go back to our regular routine. So obviously we've been having frequent meetings as it is. So having a standing meeting so that we don't have to figure out when we can get together is good. I'm simply just checking my clinical schedule for April to see if I have any problems in that regard.
And we can
if
work
you
that
give me
out
1
with
second.
Steve. We can work that out with Steve. We don't need to do it now, but just as we can, all three of us can work it out with Steve, and we just have a weekly meeting. But that meeting is simply about COVID-19, where we stand, and he, gives us the numbers and whatever else he wants to talk to us about. And maybe after that meeting, the numbers for that week or whatever get released. Would that be okay with you, Steve, and Christy and the Board of Selectmen?
Well, it's okay, but again, we have to post it, and it has to be a public meeting.
Right.
Oh,
I think it would be reassuring to the public to see the leadership involved in the fact that we're meeting once a week to do that, even if it's only a 10-minute meeting.
Okay.
So I want to just comment on two things about that. First of all, the messages come through loud and clear from the Board of Selectmen. They would appreciate getting the data twice a week, and I think that's perfectly fine. I'm not sure, I think Steve will have to figure out what's the right release schedule, and I'm not worried about whether, if he releases on Monday and we have a meeting on Tuesday, that doesn't bother me. So I want something that's going to work for the staff there.
Yeah, I trust Steve's judgment. You're absolutely right.
Okay.
We don't have time. So maybe.
And then finally, just to wrap up something that came before so we can try and move this along, the issue of a timestamp I don't think is so important as the issue of having formal reports that we can over time look at and track more easily than having a website that's constantly updated but doesn't give you any kind of history. So
I agree with that also.
So I'm fine with the website just reflecting the current data, but we obviously need these reports, and I think twice a week makes sense. So I'm going to make a motion that we ask the Director of Public Health to generate reports on the status of COVID-19 infection in Westborough on a twice weekly basis, and distribute that to the disseminate that to the Board of Selectmen as well. So I'll stop there.
Well, I'd like to amend the criteria of what's in the report to include the information that you had proposed, Alan, which I think was the whole list of number of cases and that sort of thing. So if we can include that in there. And then the other thing that I want to propose as an amendment to that is whether this should be a required that it goes out twice a week, or that it be a minimum of once a week, and that an attempt to do it twice a week. Just busy, I'd hate to have this take priority over, let's say, actual contact tracing. But again, I'll entertain both options.
I'm actually with Dr. Walsh. I'm actually with Nathan. We should once a week at the minimum, and twice a week if Steve has time. Because Steve has got plenty on his plate as is.
So my feeling, I don't care about the motion one way or the other in that regard, whether it's once or twice. I do think the report should be generated twice a week at present. Again, after a week or two, it seems like that's too much. Obviously, if we're meeting weekly, we can change that. But for now, that's been the request from our colleagues over at the Board of Selectmen. And Steve has said it's not too much of a burden. So it seems like a good starting point. And again, it can be adjusted based on whether the work is excessive, whether the caseload becomes irrelevant for doing it so often. We can make a decision as we go.
Okay, so if we're meeting once a week, I think it's fine to have the motion right now be twice a week, and I think that that's the motion that's on the table. And I think if there's any more discussion,
there is just one other thing. I assume the three of us still want to be notified when there's a positive case. Am I getting that correct? I certainly want to be notified.
So I think that's outside the scope of this. I think that's just the individual board members talking to Steve, and so I think we could probably take that offline at this meeting.
Okay. So I'll second Alan's motion with your amendments.
Okay, so we'll do it by roll call vote. Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh? Yes. Great, so that motion has passed. I'm not sure that there's anything else that's related to Board of Health business. Correct me if I'm wrong, Ian, but if that's the case, some of the Board of Health people may sign off if there's nothing else.
I actually do have one thing that we did have on the agenda. It was mentioned here, actually two things. First off, whether, look to the town manager, whether the board needs to take any action on the votes by the Board of Health. I'm not sure that we do. I mean, I think it's really the Board of Health's call, and I really respect the discussion you've had and the motions that you've made and passed. But so, Christy, anything that you think we need to do?
I don't think so. I mean, in terms of the first decision that they made, how we were treating our employees coming back to work, I think that, we hear that guidance from the Board of Health, and that's where we would take that type of guidance. So I don't think you need to do anything. It doesn't change any policies or anything that we have. And then I think in terms of the number of times you get a report, I mean, sort of internally, the way that it's been working is Steve's let me know, obviously, and then I let you all know. And so I've been keeping up to date on the website. So we'll post those reports on the website. So I don't know that you need to take action on that.
Okay. That's what I thought as well. I guess the second piece that does involve the board, we had it on our agenda, was really the discussion on a state of emergency declaration. Dr. Walsh had mentioned, others have done that. I think there's close to 100 towns that have done that. We did get information from our town attorneys on that. I think there's some question as to whether there's what a town declaring a state of emergency does, although there is some indication that it may give us preference in terms of fundings or reimbursements or potential resources, perhaps for first responders, et cetera. But I'd like to open that up for discussion between both, because if we do declare a state of emergency, I think the way that we've been counseled as the way a declaration would be, it would come from both the Board of Selectmen and the Board of Health. So Christy, anything you want to add on that before we open the discussion?
Just that I know that boards are doing it. I actually know Shrewsbury just did it tonight. Again, I don't think we're certain that it's going to give us access to any additional money or resources, but in the event that it does, then we just want to be prepared for that. So certainly there's no downside to declaring the state of emergency. I know there was a concern about causing alarm, but now that so many communities are doing it, I think that it would be prudent.
Open up for others for discussion.
So,
I agree with Christy.
Go ahead. Okay. I do think that the notion that it can raise people's anxiety should not be taken lightly, despite what other towns are doing. And so, to me, we're doing all the right things. We're following the state guidance. So there should be a specific reason why we think we're doing it what we can, in other words, what are we doing that we wouldn't be doing if we don't declare it? Now, Selectman Johnson has indicated that we might be eligible for additional funding to help with the situation. And if that's the case, that's certainly a valid reason. I have no objection to that. I do know in talking with Steve Bakari that he was successful in getting quite a bit of funding recently for just these types of things. So again, it's not clear to me that we need to do that in order to secure that funding. I'm not opposed to it, but I do prefer to do it for very specific reasons as opposed to, well, it can't hurt. So those are my thoughts.
Sorry. I guess my view is that at this point, I know, as was mentioned earlier, in other communities, they felt they needed the declaration of a state of emergency in order for town departments to operate in a flexible way to help each other. Clearly, a huge point of civic pride is we're not in that situation here, that everyone's willing to help and help where they can, even if it's cross-department or cross-function. So we're not seeing there. I do worry about the state of anxiety. Federal disaster relief is generally done by state and county or by economic area, not by individual municipality or community. I don't know how it would come down at the state. I guess if the way it becomes clear that having a local, municipal declaration of a state of emergency would benefit us, then we could do it at that time. I'm not sure we're there yet today.
So I can jump in. This is Dr. Walsh from the Board of Health, and that's that. My feeling is, I think, similar to Dr. Ehrlich's, in that if we need to do it, then we should. There should be very clearly defined reasons, and some of the valid reasons would be to get money or to help, with allowing employees to kind of work cross-functionally or cross departments. Those are both valid reasons. I look at this epidemic and how it is in Westborough, and I'd say that right now we don't have, large numbers of people dying of this disease right now in town. When I look at New York City and I hear about the lack of respirators and, all of these problems, and even when you look at that list of, cases per million, and you compare Westborough with, the New York cities and the Washington states, I look at it and I'm a little concerned that we might be declaring a state of emergency too early, in that this situation, while it is bad and very serious and we need to take some actions now, it's not as bad as it is in other places. And I wonder if we're doing ourselves a disservice by trying to declare a state of emergency too early.
And I would echo that with Nathan, that a state of emergency should count for something. I'm with my board on this, that a state of emergency, if we declare it, should mean, and there's excessive cases or beyond our capabilities.
So, sorry. I just wanted to add, so in the guidance that we got from town council that I forwarded to both boards, they specifically say that, at this time, we're not sure about the relevance to state or federal relief grants. However, one of the things that they mention is that it does send a message to the community about the seriousness of the situation. And I know that the Board of Selectmen, and I'm sure the Board of Health, has received several comments via phone and email, and probably comments that I don't even know about, related to the concern that residents are not staying home, residents are not social distancing, residents are, they're gathering on the trails and on the fields. And so if we feel that this could provide, some more information in terms of showing the seriousness of the situation, then I think that is a reason.
Ian, if I may?
Yep, go ahead, Shelby.
So I agree actually with all the comments that have been made, but at this time, I have a question, and I don't know if anyone knows it, but before I ask the question, my view on this is that while a state of emergency would certainly provide the emphasis that I think is needed in many cases. I think we should be very purposeful in doing that. And I think that probably requires, sadly, a little bit more experience with where we're at and more cases, hopefully no deaths. But I think with 3 cases right now in the collaborative work we've all talked about so far, this meeting and the prior just being several examples, I would not be in favor of declaring a state of emergency as of this meeting. I think I'm just not, I don't think we need to be on the bandwagon just because. I do have a question as to whether or not, as to what a statute like this actually means for people in the town. So if it were declared, is it something on paper? Does it put more pressure on our police department to enforce in a different way? We would really need to, I think, understand that further. Or is it just kind of just a piece of paper? And I don't mean to say it that way, but.
Yeah, I think it's a good question. I don't think, when I look at the sample declaration of emergency, I don't think it changes anything or puts anything on there. I agree with everything folks have said. I think it's something that you don't take lightly, and I think it was Dr. Ehrlich that said it, that you don't do it because, well, what's the harm in doing it? I think it should be purposeful, I think, as most everyone had said. So so I don't have an answer. I don't know if anybody else does there, but I will open up for others to talk. But I think it's clear from a Board of Selectmen majority and also from the Board of Health that is not a motion that needs to be made, because it's clear that there's not a majority on either board that would vote at this time for a state of emergency.
I think we keep it
Mr. Chairman.
older at this point.
Yep.
Yep. Thank you. You guys have convinced me. I would not support a motion either right now.
No. So this is Walsh again. I think that to say that the Board of Health recommends that people do not gather, don't go out on the trails and hang out with your friends on the trails. I think saying that in very strong language is something that I support, and probably the rest of the Board of Health also supports, is that we do need to maintain social distancing. If we get to the point where we have to declare a state of emergency, that means that we have failed to contain this. And I don't want us to get there. I don't want to have to declare a state of emergency. I want to stop it before we have a state of emergency. So I want people to start social distancing if they haven't already. I want people to do a little bit more than they're currently doing now. And if we can do that, I think we can then prevent us needing to declare this. But again, I just want to say that we could have a very strong statement come out of the Board of Health if we want to say maintain, these social distancing and do what you can to, do things more remotely rather than in person. And I don't know if the other members of the board want to, back a statement like that, but it does give us the chance to, even if we're not declaring a state of emergency, to make people realize that we do consider this serious and we're at the brink of having this become a problem that we can't handle. I'd rather have it be a problem we can handle and have things, continue to be stuff that, our regular town employees can handle. But we are at the brink where it could go over the edge, and I don't want to get there.
And just to echo that, I would just say that it should be a joint declaration from the Board of Health and Board of Selectmen that this is an unprecedented emergency. We urge that the citizens take the, governor's advice seriously. And the other thing I would, just to reassure the Board of Selectmen, I think one of the things that the advantage of the weekly meeting of the Board of Health will be to monitor if we want to call an emergency or not. I think that meeting, that's one of the reasons I wanted to have a weekly meeting. And so we monitor the situation, and if things are changing, then, we've had meetings frequently with each other, and at that point we can pull the trigger and go from there.
Yeah, I think I'm fine with that. I do think I know that we have put the messages out there pretty clear on our website and social media and all avenues to continue to do that. But I do think that the message is out there, and we should continue putting it out there. But Chris, I don't know if you want anything further update, but I know that the town through your office, has been putting that information out pretty loud and clear.
Yeah, we've been trying. I mean, in every communication, we encourage people to do social distancing. We, just about every post we put up there, we encourage it. But we do get complaints. So if the Board of Health, wants to come out stronger, I don't think that that's a bad idea, because I think that we hear people are very concerned about their neighbors and neighbors that might not be following the social distancing and listening to the federal or state guidelines. So I think it's not a bad idea, because we do hear it a lot.
And if that's the case, I think, and I'd look for the Board of Selectmen if they disagree, but I think the Board of Selectmen would be happy to be on a joint message with Board of Health, urging that.
Okay, maybe we can wordsmith that a little bit and then actually have a release sometime later this week with all of our signatures on that.
Perfect. Okay. Anything else from folks related to that meeting? And I apologize for all the folks on the phone that have been waiting, and I am going to make some adjustments on the agenda to move some stuff around for people that are guests of our meeting. But anything else from a joint meeting that we need to cover with the Board of Health and Board of Selectmen?
It looks like Alan is trying to talk, but I don't hear him.
Can you hear me now?
Yes.
Okay, I'm sorry. One thing very briefly, since the subject came up about potential funding benefits from that declaration, I would ask if Christy could pursue that and find out, does it make a difference from that perspective, and are there concrete examples of things that we would be eligible for that we're not currently, should we go that route?
Yeah, I mean, we're certainly monitoring all of our funding opportunities, and so certainly I would let both boards know if we found that there was a funding opportunity or a resource opportunity that we weren't eligible for because we hadn't declared a state of emergency. At this time, we're not aware of any, but absolutely we'll keep you all informed.
So the final thing of all of our Board of Health meetings is deciding when we meet next and how we're going to meet. And the question is whether we want to kind of do another joint meeting with the Board of Selectmen, or whether Dr. Hashmi was proposing that we meet separately. And so I prefer the logistics of kind of having one meeting, but I do realize that it takes up everybody's time. And so getting some feedback from people is useful.
Well, this is Ian. I guess my initial, it looks like Shelby wants to speak too. I personally, I look to you guys for guidance. I think you'll be more effective in a meeting of the three of you. We can call a joint meeting at any time with 2 days notice, but I would, I guess on my side, would respectfully ask that you guys meet and do the job that you do well, and, let us know. But I don't know that we have to have weekly joint meetings at this point of the Board of Selectmen, the Board of Health. But I'd open up for others what they think.
I guess I would, to Dr. Walsh's point, I think it would probably make sense. I don't want this to get ahead of us and then we're like scrambling to find time to meet. On the other hand, if the Board of Health is meeting on a weekly basis, we can certainly be added to that agenda going forward. So maybe we sort of see how this goes over the next week or two. And then see whether or not it makes sense to pull us in on a schedule that you've set.
Yeah, and they are public meetings, so we can always attend as not as a board or an acting item. So the only thing we need to have it as a called joint meeting is if we need to take action.
Right. Would it be the Board of Health's intent to have similar meetings like this? I know typically your meetings are not televised, but given the unprecedented times we're in, is that the plan going forward?
So I believe that in order to have a teleconference-like meeting, we still have to provide real-time feedback to the public because it is a public meeting. And so I think with public buildings closed, we may have to actually have it televised. So we'd probably have to work with whoever you guys usually use, Westborough TV and the likes of that, in order to try to help us set this up. I don't think we have our own meeting. Ian, you've been setting this up for us. So it's going to take a little bit of logistics for us to do our own meeting, but we aren't necessarily against that.
And two things
that you do need to have it televised. And so our IT director is prepared to work with any board or committee that needs to set something like this up.
I'm willing to.
It doesn't have to be televised. It can be a teleconference that folks can dial into as well, right?
Yeah, it could be.
I think it's publicly accessible.
May I, Chair?
Yes.
I still am in favor of having a weekly briefing, is what I would call it. That's what they're doing nationally, is what they're doing statewide. And I think it would give the public a feeling that we are on top of it. We're not letting anything slip by. The Board of Selectmen are meeting with the Board of Health, even if it's just a 10-minute one. And if it's easier to do it just as a phone conference and not have it on television, I think that would still suffice. The record would be there, and the public would know they were doing it. So that's my opinion.
So this is Alan. The one advantage to working with Westborough TV is if they're televising the video conference like we're doing this evening, they're also recording it, which means it's available for playback for anyone who can't see it live. And that's much more difficult to facilitate with a teleconference. I know most paid teleconferencing services, you can record the call. And so we could record postings, but we do have a process in Westborough TV is a great process for making videos available.
Comments there. I mean, I guess it's really up to both boards' decision as to whether they want these weekly meetings to be joint meetings, and then we'll just have to ask for folks to coordinate with everyone's schedules to ensure we can do it if that's what folks want.
I definitely think given where we're at, the teleconference like this is advantageous for the public. So I encourage the Board of Health to do that. And it's been pretty seamless for us to set this up. Generally speaking, I can't speak to Alan's time, so please do that for the benefit of the public. And I'm going to go back on what I said earlier and support what Lee had suggested, which is to have a meeting like this. It would be a meeting of both boards. And I guess given where we're at, it certainly, I'm willing to give that time of a half-hour touch base. And even if we jump off the call and the Board of Health continues with its regular business.
Yeah, so I don't think this is likely to be a long meeting. Tonight was long. The last time we met was long because there were very specific policy issues to be discussed. And I think for the most part, I'm envisioning that these are more status meetings. And if a policy issue comes up out of it, it's because things are not going the way we want. So, and at which point it will be appropriate to be taking action. But for the most part, hopefully these are really just 10 or 15 minutes.
Yeah. And then if we do need to meet, then we're all together. So we fulfill that and we're not trying to have another meeting.
Yeah.
So great.
Selectman Hashmi, can I ask from a Board of Selectmen standpoint? I don't know if I heard that or not, but I'd like to hear.
I'm the guy. Which part? I'm okay. I'm going to be there. I think. Yeah. Which part?
You're a member of both. But I respect the rights of the Board of Health. It sounds like others are fine with it. I just want to make sure that.
Yeah, I'm okay with a joint meeting. Yes, absolutely.
What I would ask is separate from this one. Dr. Walsh, would you mind chairing those meetings? I really do view it as a Board of Health, and you'll be inviting us to that meeting, but you can chair it.
So you're proposing that we have two separate meetings, but that you guys attend. I think that it sounds like we're okay with that, and I can chair that meeting, and we can try to work with the staff in town or Westborough TV to get us set up to do that. We will have to try to find a time. We typically have alternated with the Board of Selectmen on Tuesdays, kind of for this time slot, and so we're going to have to try to figure out so that we're not overlapping time-wise.
No, it's going to be one meeting, Nathan.
Oh.
It's going to be one meeting. One meeting with both boards.
Okay.
One meeting with both boards, he might kill me, but I'm gonna ask Selectman Edinburgh if he could help us continue with the making sure this is televised.
Absolutely. Happy to do that. As Christy mentioned, Mark Stockman and the town's IT department are able to do this as well. And we can certainly, it's not overly complex, so we can certainly train others and make sure that, Board of Health and any other board or commission is able to do this.
Okay, so it sounds like, to me, it sounds like everyone's in agreement that we'll do joint meetings. We just need to figure out the times, and we will televise them.
That sounds good. I mean, we could even operate it where, the first part of the meeting is Board of Health, and I'm the chair of that meeting, and then immediately following the Board of Health meeting, the Board of Selectmen meet, and that way, if there's anything that is just Board of Health or just Board of Selectmen, we can try to pad it to either end of the total meeting process. Kind of as if we were having our two meetings just in one room, and we had one meeting first and one meeting afterward, and kind of people filtered in the middle.
Okay.
Good. So let's then be the same time next week. Steve, do you think you can get that posted?
Take care of it.
Great. Anything else with the joint meeting?
I think we're all set.
Okay. Nathan, as we talked earlier, I mean, you guys are free to stay on. You guys can adjourn your meeting. I mean, we're going to go forward with the Board of Selectmen's meeting. Either way is your call. Steve, you're free to exit.
I wanted to recognize Steve for his incredible dedication and hard work for the past couple of weeks. Him and Christy have done just an incredible, as well as the rest of the town staff have just done an incredible job. They've had to work on the weekends consistently, and that dedication is worth commendation. And so
Absolutely.
I just wanted to thank them.
Absolutely. Great. Nathan, do you think you guys are adjourning, or what?
Yeah, so I guess we'll have a motion to adjourn then. Do we have a second?
Oh, I guess I should second. Hashmi, yes. I second.
We'll do it by roll call. Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh? Yes. Thank you, guys. Appreciate all the work.
Great. Again, sorry for folks. I'm going to try to move this. I'm going to move this around if folks are okay. Christy, tell me if for some reason I shouldn't, but I'd like to move to what was item 5 on our agenda, and actually move 5 and 6 up since we have folks that have been patiently waiting for those 2 items, and we will push 3 and 4 down. Does that work, Christy, from your point of view?
Yeah, that's fine.
Okay. So item 5 is a discussion vote about sending a letter of support to the Division of Capital Asset Management and Maintenance for a prospective business to locate at 187 Turnpike Road. We do have a guest. He's still on and still awake, but Craig Blaze. Craig, you still there?
Yes. Yes, thanks, Ian. Yes, I am still here. Thank you.
Okay. Christy, anything you want to do to introduce us? Do we want to turn it to Craig? And I think we did have some information that Mr. Blaze shared with us. I don't know if Alan has it or you have it to share. Or
Alan has it. Craig is requesting a letter of support from the Board of Selectmen for a proposed project at 187 Turnpike Road, which is the Green Thumb property. But I'm going to let Craig go ahead and give that presentation.
And Craig,
sure, thanks.
Craig, let me know if you want me to show the rendering or the site plan.
Yeah, absolutely fine to show the rendering and the site plan. I would just stress, first, let me just introduce myself. I'm Craig Blaze. I've been hired as a development consultant by Crandall Hicks and Don Satterfield to represent them, a larger team that is working on this project. My specific role is to negotiate, because I have experience in negotiating with the Division of Capital Asset Management on the agricultural deed restriction to come into compliance, to have this project be in compliance with the deed restriction or negotiate some type of settlement with them. There's a larger team working on this with consultants in that. What I've provided the board with through the town manager is a conceptual, and I want to stress that it's a conceptual site plan, a conceptual rendering, and a one-page from Mr. Satterfield explaining what he would like to do with the property. I think most of you know he's been a great business owner in the town of Westborough for a number of years, operating Boston Lawnmower. Has a great affiliation with Aaron's, is one of the largest distributors in the country of Aaron's supplies. And before Mr. McGoldrick's death, worked out a relationship where they were merging the businesses to keep the Green Thumb Nursery at its existing location, with the lease coming up with Boston Lawnmower at its existing location. Wanted to stay in town, see if he could work that site to make it work. So my specific piece of this is to negotiate this with the state. In our preliminary discussions with the state, they said they immediately asked where the town stood on this particular project. So we wanted to provide you with some information, but not the exact information. We have met with the department heads and know that we have to go through a complete site plan approval process. We have to go through all of the town regulatory processes to get to the point. But we wanted, if we are not able to get the deed restriction and to get this project in compliance with it or remove it, then the project would not go forward. So that's why I thought it would be prudent to come in early to the Board of Selectmen in a preliminary basis to get support, to see if you were supportive of the concept of the project, to keep them there. He is planning on, as part of the project, to keep the nursery and the greenhouse and operate that as part of the operation. I would argue with the state that his operation complements. It is an agricultural use. However, there is a difference of opinion on operating a retail operation as it relates to the agricultural restrictions. So we're going to work on that and negotiate that. Mr. Satterfield's been open to all types of end results with respect to how this gets resolved. And so he's been very flexible, which will be good with the state. And we'll continue those discussions if we get the support of the town. I'm also meeting with the legislative delegation to gain support as well to the issue. So I'll be glad to answer any questions. And I don't want to take up too much of your time because obviously you're dealing with very much more important issues as it relates to what's going on in the country nationally.
Thank you, Craig. Open up to the board for any questions. I think we also in our packets had been provided the deed, so as folks saw. So really, with that deed and the restrictions on that, what they're looking for from us is really if we're supportive of the project and this moving forward, so that they would, on their side, move forward, as Mr. Blaze said, and work with DCAM to see about how they could work this project into that current deed, either with the restrictions or with the removal of the restrictions. So definitely open up to the board for any questions or comments.
Would you like a motion to start discussion, Mr.
Sure, please.
This is Lee Emery. I move to send a letter of support for the project as presented at 187 Turnpike Road, and further to authorize the chair to sign the letter on the board's behalf.
Alan Edinburgh seconds.
Okay, thank you. Any comments from the board?
So this would get rid of the greenery there?
No, he actually he has already signed a purchase and sale agreement to acquire the property, and he made an agreement with Mr. McGoldrick to merge the businesses. So he would keep the greenhouse and the nursery operation as part of the Boston Lawnmower if the project goes forward. So he would keep the greenhouse and the nursery and maintain the business.
Right, and this is Selectman Edinburgh, and the it's really the mini golf course that's going to be replaced by the Boston Lawnmower location.
There has been some discussion about keeping the mini golf as well as part of these. Again, it's a preliminary conceptual site plan. It needs a lot more work but there has been some discussion actually in the department head meeting about keeping the mini golf as part of the overall project. But that has not been confirmed with engineering and flagging of wetlands and all of that. So there's still some work to do on that.
And
Mr. Chair?
Yes.
I'm very much in favor of this. I don't know how long the McGoldricks ran this, but I know it was pre-World War II, and it may have been even around World War I, because they used to be famous for sending carnations for major events at the White House. So anything that can keep this family business going, maybe in a slightly different arrangement, I'm definitely in favor of.
Great. Thank you.
Thank you.
Ian, if I may?
Yes.
Yeah, so this is Shelby. So thank you very much, Craig, for your presentation. I thought about a lot of things that could go here, and I think that this would be a great addition to the property. Like you, I shared the same opinion that to me it seems complementary that an entity like Boston Lawnmower, given the type of equipment that they do sell, albeit retail, is very much aligned with, if not directly, agricultural in nature, particularly some of the larger equipment that you sell that I don't have use for, but I'd love to drive around. So I would, whether or not we can include that support and to what weight it carries ultimately, as you continue your discussions with the state, I'm very much a supporter. It would be great. I've always thought that this would be a great sort of destination. I think that was the McGoldricks vision. I don't know that it fully materialized between the ice cream and the mini golf, but I think with some new life and the beautiful building that conceptually that you're proposing, I think it could be a place that we see a fair amount of foot traffic, and people really are able to get out and enjoy the space. So thank you for bringing it forward.
And if I may, Ian?
Yep.
I also think it's important that folks understand that what we're being asked to do here is to provide a letter of support with respect to the necessary waivers required from the state, given certain state level restrictions on the property. And that once that happens, this project would still go through the full permitting, design, site plan process of the town.
Yeah, that's spot on, Alan. I think Craig had mentioned that. And in fact, we had asked them, and him and Mr. Satterfield did meet with our department heads at their meeting and scheduled that to talk through a lot of these design works. Again, might have been slightly premature, and we apologize for that, because really it's this piece that really needs to kick this off, because they can't do anything unless the state is willing to work with Mr. Satterfield on that. I would just add to this, I am fully supportive of this as well. I think that Boston Lawnmower has been a company in town operating for a long time. It's well known that it's in Westborough. We want to keep it in Westborough, as we do with all of our businesses, and this is the opportunity to do that, as was mentioned, with the lease running out and actually really expand and to what other selectmen said in terms of a kind of more of a destination spot for them and for them to stay. I would also say that Mr. Satterfield's been a long-time businessman within the town, and working with the town, so it's appropriate for us to support it as well. So those are my comments. Any other comments from the board, or if not, we can.
I'll make a motion.
We already did the motion, actually.
Oh, we did?
Yep.
Oh, Alan, I'm sorry. We got that. Sorry.
So
all right.
We're eager, so we want to have two motions. That's good. Yeah. So I'll take a roll call vote. Selectman Edinburgh?
Yes.
Selectman Marshall?
Yes.
Selectman Emery?
Yes.
Selectman Hashmi? Selectman Hashmi? Okay, I didn't hear Selectman Hashmi, but Selectman Johnson, yes. So that's 4-0. in favor. Craig, we will work together. I'll work with the town manager. The town manager will work, and we'll get that letter of support written and signed and off to you to move this forward.
Thank you. Thank you very much. And I would just add briefly that it would be very helpful if that comment could be made in the, if a statement could be made in the letter that says you feel that it is in compliance with the agricultural restriction, the use. That would be very helpful for me in my discussions and negotiations with the state. But thank you very much.
Perfect. Thank you. And thanks for your patience too.
Oh, I would just add, having been a selectman 30 years ago, your level of debate between the Board of Health and the selectmen on this pandemic and this crisis is it's incredible, and it makes me want to move to Westborough. So congratulations and best of luck.
Have you, Craig? Perfect. Thank you.
Thank you.
Okay, next on the agenda is again. Moving to item 6 on our agenda is a discussion vote on the authorize the town manager to a new municipal aggregation purchasing program. We do have guests on for this one too.
I'm sorry, Ian. Did Syed just join? Can we get a? Did he just rejoin? He dropped off.
Syed, did you join?
I saw a message that he left.
I thought he joined back. Okay, sorry. I just was hoping we could get a full vote of the board. Sorry.
Okay, we see him come back on. Thanks for that, Shelby. If people can watch, we'll try to get that full vote. So this one, we do have Peter Dumbeck and John Metzger joining us for this discussion, but I will turn it over to Christy to take us through this.
Yeah, so as the board's aware, in the fall, our current municipal aggregation contract will expire. Maybe six to 9 months ago, I met with representatives from Sustainable Westborough because they were interested in getting involved with working with us, creating the successor contract. It was something that we expected to do in the summertime, but because rates are favorable right now, our consultant has reached out to us and has said that we might want to move forward at this point. But one of the things that Sustainable Westborough had said to us at the time is that they had an interest in our default rate, which is currently does not include any renewable energy. And so when people get enrolled and they can opt out of it, and so that default rate that they go into doesn't have any green energy. The interest was that in the future, with our new contract, the default rate would include green energy with the option to opt into potentially a rate that had no green energy in it. So that has some cost implications. And so I reached out to Pete Dumbeck and he's worked with a couple of members of Sustainable Westborough to provide a presentation for the board tonight so that we can move forward and take advantage of the rates at this time.
Great, thank you, Christy. Pete, are you set to go?
Yes, I am. Alan, are you going to flip?
Yep, I'll put up the slides now.
Okay, so I appreciate the introduction, Christy, and the opportunity to speak tonight. Are you able to hear me okay?
Yes.
Yes.
Okay, I turned off I just wanted to make sure I wasn't still muted or something. I am pleased to be able to speak to you about this tonight. I'm representing John Metzger and Peter Flynn. Because of kind of the short notice, we were not able to convene a meeting of Sustainable Westborough or the Climate Action Plan Task Force. Peter Flynn and I are members of the Climate Action Plan Task Force, and John Metzger and I are part of Sustainable Westborough. And John has been very active in driving the discussion concerning this community choice aggregation contract and the green default. But this is just the proposal that's going to be referenced here is the three of us speaking, and because we haven't taken formal votes. Alan, do you have the slides?
Yep.
Yeah, I see top of the screen now.
Showing.
Yeah.
Okay, I am not seeing them. Let me. Oh, okay. Thank you. So what you're seeing here is a kind of a quick review of the current contract. And the key point I wanted to make is that there were two plan options. A standard, which has the minimum state required renewable energy. So it does have some green energy, and right now it's 16% green energy in the standard plan. And there is an option to opt up to 20% additional class 1 renewable. The key point here is that the default was the state minimum renewable energy, and it required an action by people to opt up to the greener option, and it wasn't heavily used. In fact, it was hardly ever used. And so our goal is to increase the use of the greener option, and to do that through making it a green default. And if you could go to the next slide, we'll kind of quickly, I know we're kind of way over on the time, so I'll try to go through this quickly. So we'd be proposing to change in the new CCA contract to a green default, and this would have significantly more class 1 renewable energy. And one thing I'd emphasize is that it's class 1 renewable is a state-defined term for a type of renewable energy that comes into the New England grid. And it's designed to, by including class 1 renewable, it encourages the build out of a greater quantity of renewable energy in New England. So by putting this as the default, we would encourage people and increase the use of the green plan. And by doing that, it helps us achieve the town's goals for greenhouse gas reductions. It's consistent with the state goals, and it's consistent with the goals the town has set in regard to the setting up the climate action plan. There are costs associated with these decisions, and cost-sensitive customers, we'd have an opportunity for them to opt down and return to the minimum renewable that the state requires. And for environmentally concerned citizens, residents, we'd be able to opt up to 100% renewable. And then, of course, the question is how much renewable energy is in the green default plan, and what is the cost impact of that? So our proposal, because we don't know what the current market conditions are, is to set up the green default so that the annual cost impact is no more than a 5% increase compared to the minimum renewable plan, so the minimum state requirement. And if we go to the next slide, please. This is kind of a graphic view of what I just said. People who have taken no action would end up in the green default, and by doing that, they would be getting 20% additional renewable energy over the state minimum. The state minimum is 16% this year. Next year, it'll go up to 18%. So with the green default, you'd get twice as much renewable energy than the minimum state requirement. But any resident can opt either down to the minimum state or up to 100% renewable through an interface that we would try to make very clear, promote, educate people on. And it's one of the actions that I'm encouraging Sustainable Westborough to take on, is to help educate people on this plan and increase awareness of these options. Next slide, I had a quick analysis. Again, this was built based on, we don't know what the current market conditions are. So as Christy said, the consultant that we're working with has told us that the market conditions have changed. And so some of the prices here we should consider just examples. But the way this was put together, the I used the pricing that is in the current community choice aggregation contract to put these together. So the first three columns are for the green default, and then the minimum renewable plan, and then the 100% renewable. And the last column is the National Grid Basic contract, which is a 6-month price that changes every 6 months. The numbers shown in the first row are the supply, which is really the variable we're talking about in this question of the community choice aggregation. The next row is the delivery or the transmission network, and then the total cost. The annual cost is calculated for the average resident who uses about 7,700 kilowatt hours a year. And you can see that using the current contracts with 20% more renewable energy, the green default is about 3% more expensive than the minimum state renewable. So you get twice as much green energy than the state minimum for only 3% more. And I believe that many people in Westborough, the majority of people in Westborough would be happy to pay that if they just knew that and understood it. Then they can also opt up to 100% renewable if they're willing to pay a 9% premium over the green default. So again, these are just numbers as examples. We're going to work with the town manager and the consultant, Christy and the consultant, to learn about the new market prices and put together a proposal that we'll bring back in a future meeting.
Perfect. Christy, anything you want to add there, and then I'll open up to questions?
Not really. In your packet, the motion that I provided for you is to designate one selectman to work with Pete and I and the consultant. We have a call with them towards the end of this week, and then we could bring it back to you. We could bring it back to you next week, potentially set up an additional meeting next week, and bring it back to you. Bring the plan back.
It sounds like we're already gonna have a meeting next week with the Board of Health now, so we may have the meeting already.
Yeah.
Books. Okay, this is great. Thank you. So really, what ours is tonight is really, I guess, the discussion about any questions we have on what Pete proposed, and then the second piece is if anybody is willing to volunteer or nominate a board member to work with the town manager's Sustainable Westborough or Christy and Pete on this one with the consultant.
So this is different than the aggregation that we've been. So this will be our third, but because we're talking about creating a different sort of tiered concept, before the default rate was always the cheapest rate, and so that's why this process is a little different than we've done in the past.
Yep.
I have a question.
Yep.
So help me to understand the timeline around this process. I do understand from our packet that our current contract expires in November. And the bids are open, I guess, opening in April.
They're recommending that we go with that timeline. So they've given us what they call indicative pricing, which is the initial pricing, which is confidential. And so then we would have a call to discuss that with them. And that's something that whoever was designated by the board could be on. And then also Pete for Sustainable Westborough would be on, and myself. And then we could bring information back to the board. But then the actual bid opening would take place in April. And we would be entering into that agreement beginning in, I guess, November of 2020.
Okay, so the bids are confidential, and all right, I guess I'm not understanding the process. Where I'm going is, I think this is a major decision for us as a community, and I'm trying to understand whether or not through this process, as we have the designee from the Board of Selectmen works with the parties you've already named, would we then have some sort of public hearing around this? Because No, you're shaking your head no.
Well, I mean, you can't we can't bring to the public. So when the bids are actually, let me back up. We can't bring to the public the indicative pricing because it's confidential. That's actually on your executive session tonight. We actually won't discuss it in executive session tonight, but it falls under the exemption because it trades under trade secrets, which is what is on your agenda. And then once the bids are open, it's something that needs to be entered into that day because the prices are only good that day. And this is similar to what we talked about when a few months ago when we entered into a new contract for the town buildings. And so it's something that has to happen quickly.
Okay. I'll let others comment before I add some other thoughts.
Alan, looked like you wanted to comment.
Yeah, I mean, I think given where we are with electric rates, given the cost of petroleum right now and natural gas, I'm hoping that moving early will give residents a great advantage. I mean, recently, National Grid's fixed rates have gone over 13 cents per kilowatt hour. So our current aggregation rate is saving both residents and businesses on the program, 20, 25 or more % on the cost of the power itself. I'm comfortable with having the default rate not be the lowest rate and being the green rate. I think that fits with the goals that have been established by town meeting to become a more green community over the next 15 years. And it sounds like there will be a plan in place by the time we get to October, not only for communications, but an easy mechanism for residents to understand the program and understand what the 3 power options and pricing options mean to them.
That was one of the roles or the goals, I guess, of Sustainable Westborough in terms of being involved in this program was not just being involved at this point, but really taking on a role. And Pete, you can correct me if I'm wrong, but really taking on a marketing role for the community. Certainly spending a lot of time at the senior center, explaining, sort of what the options are, how to opt to a different rate if that's something that people choose, and certainly spending a lot of time with, just with the community in general so that they understand what their options are, how the program works, but that they could go greener or less green for less money.
Yeah, I can elaborate on that. One of the things we found as we started studying this was that there was very low awareness in the community that there was a greener option. So people were put into the default who would have preferred to be in the greener option, but they didn't know it existed. Second, there was also some service problems with the contractor who was managing the process at the time, that it was very difficult to opt up after you got into the default. So our involvement, John Metzger leading for Sustainable Westborough, myself, would be to make sure that the service delivery is efficient and clean and it can be done on a website, and then also to provide communication and education, potentially have sessions at the senior center and at other venues where we could help people do it, because no matter how easy you make it, will still be confusing to some people. So I think we'll need to do hand-holding. The last point I wanted to make on flexibility is that you can change levels at any time. It's not you have to sign a 2-year contract or anything. So it's flexible, both where you come in at the default and whether you make an option, you can reverse your option. I believe it's like with every 2 months or something. Again, that's a detail we'd have to put into the service agreement with the provider.
Great, thanks. Any other selectmen? Shelby, I see you up there.
Well, I know others haven't weighed in yet.
Other selectmen? I guess I'll jump in. I mean, I'm supportive of this as well. I'm supportive of going with the default option being the greener option. I think it's the direction the community has voted to move in. So fully supportive of that. I do appreciate having the, kind of opting out to a lower price for those that are cost sensitive. So we're not excluding that option, but making it an opt out. So I appreciate having that in there. So fully supportive of that, fully supportive of the program, appreciative of the help that's coming, from our volunteer boards. I guess the one question I have, Chris, and this I'm not clear about is, maybe explain a little bit more the timing now versus, like, if we don't act now, we wait. What we have to do something before November, but what it sounded like that there's been indication that now is from our consultant maybe or whatever, that now is a appropriate time to act because of where rates are, or what's or is it just that this is the time you have to do it to make it in for November?
No, I mean, we could certainly wait because it's not till October, but we would never be able to hold. Well, first, so our consultant has identified the rates being good now, which is why we want to move now. And just like when we did the other contracts for the municipal buildings, the rate changes every single day. And so we would never be able to hold any sort of public hearing with definitive numbers for the community to consider. And I think that's why Sustainable Westborough is putting forward this proposal that it not be more than a 5% cost over the current basic rate.
So, Christy, if I understand you correctly, if we act now on the consultant's advice and put together this group, it gives us time to then go out and educate the community as to the choices, the changes being made, and the choices that are available: opt up, opt down, etc.
Yeah, yes, that's a great point. I mean, certainly more time, I think, than we've had in the past.
Okay.
So we would have we would have till November.
So I know that Syed has been trying, just for everyone's benefit, Syed has been trying to get back on. I don't know, he's having issues with the muting of his line. I am more than happy to be one of the two selectmen if we ultimately decide to have two to work on this.
Mr. Chair.
Yep.
This is Lee. I'm obviously in support of it because I'm on the Sustainable Westborough committee, but I am concerned, and I think it is hard to understand. I'm having a hard time sort of understanding the whole thing myself. But if we adopt this new scenario where you have three options, I guess, is there an option where a senior citizen or someone else on a fixed income can opt for something that won't cost any more than what they're doing now?
No. Well, because the rates change all the time, just like if you were on a basic service with National Grid and there was no community aggregation, the rates can still change. So we can't guarantee that the current rate is something that we'll be able to get for the next contract. But when we set up this tiered system, anyone would have the option to opt down, like Pete was showing on his slide, and save money that way.
Okay.
And Chris, if I understand it though, we don't know until we see this, but there is when we see those rates, which may be next week, it could be that the default rate, which includes more green, and the minimum are less than what we have now. They could be the same. They could be more. I mean, it's really, we don't know.
We don't know.
Yeah.
Good point.
And beyond the options that are on the screen, every utility customer in the state can opt to go to any supplier they want. So these are just the ones that are in the community choice aggregation plan and National Grid's basic. But there's 150 other people out there selling things. One of the problems is some of those people that are selling things that are called green are not nearly as attractive as this. So I think part of the value we bring is by vetting this on behalf of the residents, we can commit to them that this is good quality class 1 renewables. We can explain what that means. We can make sure that the prices are fair and it's not somebody greenwashing overpriced electricity. So I think there's value just in the community choice aggregation of bringing these lower prices to the community, as well as ensuring that when somebody sells you something that they call green, that it is in fact good green class 1 renewables.
And also to sort of restate the process, today you would designate people to be able to basically sit on the call with me on Thursday to understand what the indicative pricing is, which is like preliminary pricing. And then we could have an executive session next week to go over with the full board, so that you can really see what what we would potentially be signing up for. I mean, obviously, like I said, when the bids are open, the rates change every day, but the indicative pricing is intended to show us what we could expect to get.
I want to ask a point of clarification, building off of what Lee had asked. So as we're looking at this slide now, do I understand that if we were to enter into a higher level of green energy by default, does that remove the National Grid basic option? In this example, does the 10.004 become the lowest available rate for an individual that's part of community choice aggregation?
No. So the National Grid basic option, so the column all the way to the right, would be what someone would get if they are not part of the municipal aggregation plan. And that people can absolutely choose to opt out of. If the middle column of the other three, so that 9.3 would be what you could opt down to.
Okay.
Default rate would be where you would go without doing anything. And then that third column, the 12.06, is where you could go to be 100% green.
Yeah, I think to what Pete said is you have the National Grid, but there's also many others out there that would sell you that supply. And you got to be careful. The reason, hopefully, and why we've done community aggregation is by aggregating, we typically can get locked in and better pricing for the longer time. There may be some that will attract you with a low starter rate and then jack prices up. But again, that's still folks' choice. The hope is that by doing this aggregate and having the community, we give the community a benefit by doing it through the aggregation program.
I was going to echo what Ian said, as far as oftentimes residents get letters and phone calls offering a really, really low rate. Typically that's for a very limited period of time. I received a letter where that low rate was only guaranteed for a week. And then of course it skyrocketed even well above the high National Grid rate.
So I've heard Syed, are you on?
Yeah, can you hear me now?
Yes.
So just to echo what you guys have already said, I recognize the economy is tanking and the prices are going. Saudi Arabia and Russia are engaged in a oil war, so the prices are dropping down precipitously. Having said that, I just want to make sure that we understand that I recognize that the economy is in a free fall, so we need to be cognizant of what the economy is going to be like 6 months down the road, which is something certainly I can't predict, but I'm exceedingly worried about. Does that make sense? I just want to make sure that that we don't.
Yeah, sorry, this is Shelby. I think maybe without saying it, we're all thinking about the future of our economy and what it means to us individually, and certainly to those who are already struggling. And we've had many conversations about our taxes and so forth. I think I look at this as an opportunity to work with our consultant who understands this market. And if they're advising us this is a good time to get in early, so to speak, and it allows flexibility, and we can educate the public on what the choices are, that ultimately we might save some folks some money. while offering some green options, obviously.
Right. Any other comments there? I think Shelby has volunteered to be, I haven't heard from anybody else to be part of that.
Thanks, Shelby.
So does someone want to make a motion with Shelby in there?
Yes, Mr. Chair.
Yep.
This is Lee Emery. I move to designate Shelby Marshall to work with the town manager and Sustainable Westborough to develop a tiered structure for the municipal aggregation program, and further to authorize the town manager to enter into a new municipal aggregation purchasing program.
Is there a second?
Edinburgh seconds.
Okay. And just to be clear, while we're authorizing this, as Christy mentioned, this is coming back to the board hopefully next week for our authorization. But the authorization there is that when it, as I understand it, once it's open, we need to execute, and that's what this would provide, I believe. But Christy, correct if I'm wrong with that.
Yes. No, you're right.
Okay. So any other comments or questions on that? If not, a roll call vote. Selectman Emery?
Emery, yes.
Selectman Edinburgh?
Edinburgh, yes.
Selectman Marshall?
Marshall, yes.
Selectman Hashmi?
Yes.
And Selectman Johnson, yes. So it's 5-0. Syed, I know you were having connection problems there. I did want to go back to the last vote that we had, because I know you were on, and ask some questions there to see if you wanted to.
Yes, thank you.
Vote on that.
Thank you. Yes, thank you very much for your consideration, and yes, I'm in favor of it. Thank you.
Okay, thank you. So that's for the question on the letter of support to the Division of Capital Asset Management. That's updated to a 5-0 vote. So thank you, Selectman Hashmi, on that one. Great. Pete and John, thank you very much for joining us. We appreciate you. Again, appreciate your patience and hanging on as we were well behind schedule.
Well, thank you very much for entertaining this and supporting it. Thank you.
Thanks. Okay, let's move back up to question 3. This is a discussion vote to designate April as Donate Life Month. Christy, do you want to take this? I know this is one that folks on the board, Ed Bain has done this for the last few years. So the board has supported it. We advised him that he didn't need to come and present tonight, but he did provide the materials. Christy, anything to add there, or?
No, I would just say that the board's done this the last few years at his request. And so the proclamation that's in your packet is the same as the one that we've used in the past. And other towns are doing this as well. I know he said that, I think he said he was talking to Shrewsbury also, so.
And just to note, if folks did look through it, if we do move forward and someone wants to do the proclamation, I think the date just has to be updated. I looked at it, it says April 2018. Of course, it's April 2020. But any comments or questions?
I'll make a motion. I'm happy to make a motion by reading the declaration.
Okay.
Okay. Whereas there are more than 114,000 Americans with more than 5,000 in New England who are currently waiting for life-saving organ transplant, and whereas there are over 1 million life-enhancing tissue transplants each year that are made possible by the generous donation of corneas, bones, skin, or other tissue, and whereas we can all help to save someone's life and benefit up to 50 recipients by signing up to be an organ and tissue donor by enrolling in the Massachusetts Donor Registry when we apply for or renew our driver's license, or by registering online at www.donatelifema.org. And whereas Massachusetts is a leader in donor designation rates and is dedicated to making it fast and easy to sign up to save a life through our registry of motor vehicles, and whereas this observance pays tribute to organ and tissue donors and their families whose decision to donate life enables others to receive life-saving organs and tissues for transplant. Now, therefore, the Board of Selectmen of the Town of Westborough do hereby proclaim April 2020 to be Donate Life Month, and urge all citizens of Westborough to take cognizance of this event and participate fittingly in its observance.
I'll second that.
Oh, Christy, you're yawning on me.
Sorry.
I'll second that, Chairman Johnson.
Sorry, what was that, Syed?
I'll second that motion.
Okay. Moved and seconded. Any comments? Not. I'll entertain a roll call vote. Selectman Hashmi?
Yes.
Selectman Marshall?
Yes.
Selectman Edinburgh?
Yes.
Selectman Emery?
Yes.
And Selectman Johnson, yes. So that's 5-0, 5 being present.
Great.
Okay, next up is the discussion vote, purchase and sale 30 Belknap Street property.
So I can be brief with this. We don't have the purchase and sale agreement ready for you, but one of the things that I did want to talk about, and I think we've talked about in previous meetings, is that the seller is interested in the property being named after the family. And so the proposed name at this point is Zwicker Farm Conservation Area. That would be a term within the purchase and sale agreement. So we just wanted the board to decide whether or not you were in favor of that, understanding that we would be using some of the Walkup Robinson Trust money, and that requires acknowledgement of the Walkup Robinson Trust as well. And the seller is very aware of that, which is why your motion includes the name, but also the necessity to abide by the Walkup Robinson Trust documents.
Great. Could I ask for a motion on this one?
I can make that.
Okay.
I move to agree to name the property located at 30 Belknap Street the Zwicker Farm Conservation Area, while recognizing and abiding by the requirements of the Walkup Robinson Trust.
Second.
Okay, and seconded by Selectman Marshall. Comments or questions?
Yeah, Mr. Chair, I have a couple of comments. This is Syed Hashmi.
Yep.
So, initially I'm still in theory favor of this, but and I'm in favor of the motion to acknowledge the Zwicker family. That's not my problem. I'm hoping that the next time we discuss this, or prior to that discussion, Christy can provide us with the sell-off in the markets. I would like to know where we stand with regards to all these funds and what the value of these funds are because of the drop in their value. Has there been a drop? How much has there been a drop? So prior to us proceeding with this, it would at least be helpful to know what the finances are to fund this.
Yeah, I think that's fair. I noticed Christy writing it down and shaking her head. So yeah, we can do that. We still need the purchase and sale, and as we all know, this is still an article on town meeting that town needs to vote for. And Syed, I think that will be great for you to bring that up. It's only a question that's going to come up at town meeting as well, and we'll continue to update it depending with what the market's doing, and hopefully it's going to recover and not continue to drop, but we don't know.
Right, and so and along those lines, if we could just get and I think I'd ask, could we just get a listing of all the other funds that we have, just to kind of and I know this is probably every day it goes, it is having really big swings, but it would be helpful just to get a sense of where we are and what our other obligations are separate from Belknap, because there are other. Sorry, go ahead.
Go ahead.
No, I'm just saying that, again, I know you presented this data to us, except that was almost like a lifetime ago, and it's now a different world. And so I'd just like to get some more data before I, proceed along these lines.
Okay.
Yep. Yeah, and Christy, I'm not sure that we may get it daily. We absolutely definitely get it monthly. I'm just not sure how the reporting is done on that, but if it is monthly, we're going to want to wait till we get March's information, because February's is not going to tell the story of what's happened this month. So, but hopefully we get it daily. I just don't know whether we get daily valuations or not.
And it would also be helpful to know because there are other commitments, like we have Grove also in the pipeline, right? But I know that's not Walkup Robinson, but that's still funds from the town. So I just would like to know, with all these commitments to property that we are committed to buy, where we stand with the funds to buy them.
Yep, that makes.
Yeah, well, the 9 Grove. Yes, yeah, I can give you all that information. I actually just got a text from Leah. She said that we get the reports monthly, so I will get that to you.
Perfect. Any other comments or questions? And again, what we're doing here, this is not enough. The P&S is still something that is going to come before us right now. This is only to, if this moves forward and is voted in, that the property would be named Zwicker Farm Conservation Area, and P&S, and abiding by the requirements of Walkup Robinson Trust. So, Lee, because you're right in front of me, I'll go with Selectman Emery.
Thank you. Yes, I'm in favor of this.
Selectman Edinburgh.
Yes.
Selectman Marshall.
Yes.
Selectman Hashmi.
Yes.
And Selectman Johnson, yes. That's 5-0 on that one. Okay, town manager's report, an hour and 20 minutes late.
Big surprise. All we've really been doing is COVID-19 response. You know, every time we felt like we have gotten into a good, we set up a good work structure or schedule, something happens that changes that. So we've been trying to just respond really quickly and also making sure that we're getting the information out to the community. I put this in my report, but I really want to thank the department heads and all the employees who have been really flexible and very diligent. Definitely thank the board for the support that we've all received from you. And also the legislative delegation has been amazing to work with as we're working through all these emergency bills that the governor is filing and submitting testimony. But I just want you to know that I have another communication ready to go out that explains what we're doing now, which is we've moved the majority of our staff who's considered non-essential and able to work from home. So we have some staff coming in and out of the building, but not as much on-site. However, we have the ability to have the phones ring to people's home phones or cell phones. And so we are still available. We are still available by phone and email. And certainly, you know, people can call the main line and they'll get somebody. So that's important that we want to get out there. And then also, our COVID-19 webpage is getting very long. So today, Mark Stockman and I have worked on creating sort of a more user-friendly COVID-19 webpage that people will be able to click to and get lots of resources. So if any of you have additional resources you think we should add, we can absolutely do that.
I think that'll be helpful with what we talked about with the Board of Health tonight with that update. Now we can have that kind of top of the page that people can see, which I think will be great.
Yep. And that's still going to be accessible just by clicking on that red alert banner on the homepage.
Perfect. Okay, thank you, Christy. Issues and correspondence of Selectman Emery. Lee, still on mute, Lee.
Thank you. You caught me by surprise, Ian. I do want to say how much I appreciate the fact that Christy is a new, town manager. We have a new assistant town manager, and to have all of this happen in your first year of really working stuff out, I think is a challenge that I probably can't completely comprehend. And the same for Steve Bakari, the Board of Health. You're doing a great job. I really appreciate it. And you're climbing that learning curve really well.
Thank you.
Thank you. And I don't have anything else. I was thinking, though, as an idea, I thought I'd reach out to Amber about it. Because not everyone, people may have the capacity to use their computers or their cell phones to access these meetings or to set up meetings with their friends so they can do more remote social activities, but they might not actually know how to do it. And some of them are at no cost. Some of them are very cheap. Some of them, I guess, are more expensive. So I was wondering if there was any way, if there was a club at the high school of IT kids that might be interested in volunteering their time. If a citizen calls and says, can you just tell me how to use Zoom or something? I know a lot of teenagers are incredibly savvy about this. So I thought I'd ask Amber about that if you folks think that's a good idea.
I would say that Maureen Amiot would probably also be very interested. I mean, the creativity of the library folks has been amazing, and I'm sure they would also be willing to be helpful with that.
Maybe I should start with her, where she does so much outreach.
I was going to suggest that, Lee, not to suggest that the library isn't busy, but I know that the schools right now, as they're trying to figure out the long game here with so many different factors, I would start with the library.
I'll do that then.
So I just got a text from Amber. So we have a large viewing audience, and she's also very happy to help. So
Great.
So Lee, I give you authorization because you already did it.
Right. Thank you. And that's all I had, actually.
Perfect. Alan.
I don't have anything too specific. I do want to give a shout out to the library. I'm heartbroken that in the governor's decree, libraries are not considered essential services, particularly given the creativity and with the gusto that Maureen and her staff were able to continue to provide services with the curbside pickup. So I want to thank them for all that effort and creativity, and I know they're promising more to come, and I can't wait to see it.
Yeah, I would stress that the only thing that's changing with the library is no more curbside pickup, because they are just embracing, everything that they can do for the community during this time.
And I do also want to give major kudos to our school department. In my professional business life, we work with schools on issues like remote learning, and it is hard for most people to fathom the amount of effort, coordination, and training that has to happen from the leadership, the school committee and the leadership down, through the department chairs, down to the faculty and staff throughout to make something like this workable. The fact that we have a viable system in place to begin with puts us months ahead of other districts. And the effort to adapt what was originally built for the occasional snow day to a long-term solution is not insignificant, particularly when guidance from the federal government and the state on what's allowed and what's not hasn't been clear. So kudos to them for all their effort and work and their continued success.
Thank you. Selectman Marshall.
Great, thank you very much. First of all, I want to thank all of our first responders, our public safety officials, for all that they're doing every day. By the nature of their work, they put themselves on the line and risk their lives on a good day, if you will. And I don't think we can say it enough to appreciate what they're doing now that we have COVID-19 as a daily noun that we're using every day in our lives. I also want to thank all the healthcare professionals beyond them for going to work, and anyone that's being considered essential, because as I sit here and sort of look out my window and I'm working every day, considered an essential employee. There are a lot of people out there enjoying themselves, and that's great and getting fresh air, but that's not the benefit that everyone has for any number of reasons. And so to that end, I'll echo my same words of caution and really stress that it is so important that we adhere to social distancing. And please don't take for granted the fact that if you have the ability to be out and enjoying the day, that gives you the right to put yourself or anyone downstream in jeopardy through ignorance or lack of adhering to social distancing. The other thing, on a positive note, I will say that it does seem at the federal and state level relative to our businesses that there's some good news on the horizon in terms of some relief. So as certainly a representative from the board to the EDC, I want to encourage our businesses to pay close attention to what's happening at the state and federal level. I want to thank our representatives for, Christy already said that they've been great partners. For those that are interested, Representative Dykema and Kane specifically have some really easy to read. I've found updates, and you can contact their offices and get on their mailing list. But if folks are interested in that, they're very helpful. I also want to ask folks, particularly our seniors out there that may be watching, pay real close attention to scams at this time of year when there's a crisis. And unfortunately, people take advantage of that opportunity to prey on people and their fears. So if it sounds too good to be true, it probably is. and don't give away your personal information. And if you have questions, please call our Christy, I think it's fair to say call our police department if there were questions. And finally, I'll just let the board know and the public, I host a monthly TV show called Frank and Mary, and we're switching gears a little bit to try to bring a weekly TV show in a more informal setting to the public. We'll certainly use information from tonight's meeting. Steve Bakari is actually going to be our guest, but it's like a less formal way to present information to the public. And as Lee had already mentioned, many of our seniors may not be even tuning into this meeting live, but they do watch public TV. And I can't thank the Westborough TV station enough. They're online too with us tonight for all of their work. But if the board would like to come on and be our guest on a weekly basis, or you have ideas of how to communicate information or what to communicate in a more informal setting, come on board. You're welcome to be a guest, and we're doing it remotely. So thank you for the time.
Great, thank you. Selectman Hashmi.
So I had, just to echo, I think Churchill said it best, we owe so much to so many. Actually, he said was so much was owed by so many to so few, and we are all grateful for that. And one of the things I would encourage us certainly to do is that, this is the time for us to be open and receptive to new ideas, and so I hope we'll do that. And one of the other things two things I would just encourage the board to do is I think that we really need to look at our response to this crisis as a town. And one of the things I recognize, there are efforts being done on a national and state level, but I really do think that we as a board should prioritize this and make this a priority of the board and of the town manager to have a town-wide recovery plan. And there could be various components of that plan, including helping small businesses, helping residents, because one of the things that, again, I'm not the economist on the board, I'm not the numbers guy, but when Goldman Sachs projects a fall of 24% of the GDP in the second quarter of the year, even that catches my attention. And so I would just urge that the board consider discussing how, I know we've had discussions, we had a discussion today, we had a discussion previously about elections and about town meeting, but I think we still need to have an ongoing discussion about our response to this crisis and what we can do to help the residents in our town, including the most vulnerable. And I have ideas for that, and so I just want to have a forum to discuss that. And then on a much more, happier note, I also was going to ask the permission of the board I actually wanted to inform the board that one of our residents, Siri Devi Thermalai, who's the founder of the Nachimani School of Dance, will be honored with the Lifetime Achievement Award at the annual India Miss New England Women of the Year Awards. This is, given in honor of her extraordinary contributions to the world of Indian classical dance. She's also a philanthropist, and so this is this is an incredible achievement. Of not only keeping a storied tradition alive, but transmitting it to a new generation in a new land. And so this is something I think we should be proud of and celebrate. So if the board is interested, and I'm happy to work with Sila to draft a letter. Is that
great? Thank you. I just I said a lot at the beginning, so I don't want to repeat.
Ian?
Yeah.
So is that something the board?
I had asked if Sila could draft a letter on behalf of the board.
I'm sorry.
Sorry. So is that okay, or?
I second that.
Yeah, I have no problem. I think that's fine.
All right, and then just one last comment for me. I want to express my condolences at the passing of an extraordinary person, Alan Stern. Alan and I we're both children of Abraham, brothers from a different mother, and though we were raised far from each other, we had been shaped by similar experiences. And And he went out of his way to welcome me to New England, taught me how to survive my New England winter, and was one of the first people to sign my nomination papers. And so that his passing leaves a large hole in my life, and I miss him, his laughter, and the world is poorer without him. And I just wanted his loss to be acknowledged by the town. So that's it for me, Mr. Chair. Thank you.
Thank you. The only thing I had is again, just for folks that heard me at the beginning of the meeting, I'm not going to repeat any of that, and I do appreciate everything else said by the board. What I don't think I said at the beginning, but for folks to recognize is that we as a board are taking the COVID-19 seriously. The orders from the governor to be socially distanced and working remotely. While the work of the board is essential, we're able to do it this way. We hope that folks appreciate that and see what we're doing. We're trying to do our part. We encourage everyone to do their part as well, so that we can, hopefully keep this as contained as possible. It all starts in a community and it grows from there. So if we can do our little bit in Westborough, hopefully that helps us all. The one other thing is requested by the town moderator, just to let folks know so we don't forget that while we have postponed town elections and the town clerk is working through her channels and figuring out when we will reschedule that, the town moderator, as mentioned at our last meeting, said basically that the town meeting was postponed. He is moving forward with that. So town meeting scheduled for this Saturday will be postponed. And again, he's working on what those dates will be, but I believe this coming Thursday is his plan to have that notification out. But just so folks know that that meeting will postpone and be rescheduled to a later date. His intention is to follow the rules that are in place right now, although there are numerous discussions and legislation that may impact that we are, he is, as well as the board is, and the town manager on behalf, helping to hopefully shape those things to provide what we need as a town to basically still effectively govern, but be able to delay this to a time where we all feel comfortable meeting. So just wanted to again, let folks know that will be that the town meeting will not be happening this coming Saturday. That will be postponed to a later date, and we'll keep everyone updated well in advance of what those rescheduled dates will be.
Can I just add something? The senior center, I should have made this point earlier. They're still working, and so they're still able to provide outreach and assistance if there's someone who is in need. So if you or someone you know is in need, you should absolutely contact the senior center, and they can help coordinate that outreach.
Great. One other thing that I forgot to mention, but was reminded by another selectman, and thank you, was that we do need to recognize our town manager for a tremendous achievement of being awarded her certified manager from the ICMA. Did I get that correctly? It's the International Council.
International City Managers.
Right. So congratulations. It's a lot of work and a lot of time put in, and we're proud, very proud of you as a board and as a community. So congratulations.
Yes. Congratulations.
Yes, congratulations.
Thank you.
We should have Sheila write her a letter.
Yeah.
From the board.
Alan, can't you play some applause over the line or something?
My fingers are tired.
Yeah. I would, Shelby, do you want to do a motion for executive session?
Yes, I would be happy to do the motion. I don't know if I have the formal language in front of me.
I think we can go off the agenda.
Okay, hang on just one moment, please. Thank you. I guess it's right there. I move to enter into executive session pursuant to General Law, Chapter 38, Section 22F, to review for the review and approval of executive session minutes, to discuss trade secrets or confidential, competitively sensitive or other proprietary information provided, and to discuss strategy with respect to collective bargaining.
I second.
Second on that, and as the chair, I declare that actions in open sessions would be detrimental to the discussions, and this requires a roll call vote, and we will not be entering into open session at the conclusion of the executive session. So roll call vote. Selectman Emery.
Emery, yes.
Selectman Edinburgh.
Yes.
Selectman Hashmi.
Yes.
Selectman Marshall.
Marshall, yes.
And Johnson, yes. So we are moving into executive session. For the board, there is a separate session for us to dial into for that. So if we hang up and can dial back in, that would be great.
Thank you.